28th, 2020 regular meeting of the Hendry County School Board. If you will join me we'll have Reverend Brown lead us in the invocation.
Okay, let us pray. Eternal God, our Father, we're so grateful for the chance to come and discuss the business of Hendry County. We ask you now to bless our meeting in Jesus' name. Amen.
Amen. And we'll continue with the pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
If we could remain standing for a moment of silence in memory of Patricia Conley. Mrs. Conley was employed by the district as a food service worker at Up the Grove Elementary School from 1987 through 2014. Thank you.
Okay, Superintendent, our LaBelle area of retirees.
Okay, and are there any retirees who are here tonight? We didn't think there would be, but we will get these to them. And for the record, I'll just read their names. The first is for Leslie Mathis, who retired from us as Director of Information Technologies. She served the Hendry County School District for 33 years, and her last day was June 30th. Jane Hatfield has retired, thank you, as principal of LaBelle Elementary School. She served Hendry County for a total of 21 years, and she also retired earlier this month. Crystal Robbins was a teacher at LaBelle Elementary School who served us for 24 years and retired earlier this spring. Pamela K. Nairhood was a teacher at LaBelle Middle School, and she served us for 20 years in Hendry County, retiring at the end of the last school year. Catherine Lytle retired at the end of the school year as a paraprofessional from LaBelle Middle School, and she served in that capacity for 32 years in Hendry County. Lily Mendoza was a migrant advocate recruiter with the Federal Programs Department and worked with our district for 31 years. Lydia Foz was a bus driver for LaBelle Transportation, and she served us for 21 and a half years transporting students. So we have quite a few years represented of service to Hendry County, and these people will be recognized.
Thank you, Superintendent. At this time, do you have any citizen comment on agenda items? If you would like to comment on anything that's on our agenda tonight, we would ask you to please fill out a speaker form so we have that for the public record. So do you have something to be read, or is there somebody
I do have
want to
something
come up and speak?
to be read. We received this email today. Good afternoon. Let me begin by saying I cannot imagine being in your shoes at this moment with the decisions that in my years of experience with children we have never had to face. It is my experience that children need and crave routine and structure. These things, unfortunately, are not often provided at home, but rather at school. However, there are also major concerns to think about: mental, hunger, love for students. When I printed it. for students not at school. To paraphrase, there are other benefits to school than learning. So she is asking everyone to consider these needs of students when you make decisions for reopening. And this is from LaDawn Hayes, a fourth grade teacher at Central Elementary School. Okay, Madam Chair, that completes the input.
Okay, fantastic. Do we have anyone in person here who wants to speak?
Can I wait until
To this
y'all talk about the reopening of schools?
All right,
If I
that's what
feel
you're-
like I need to ask a question or anything?
Okay, yeah.
We have Kim Stitt, who is representing the teachers as HCA president, and she would like to speak. She would like to speak to address HCEA's response to reopening plans and masks. And she would like, if possible, to have the time limit extended.
I don't have an objection to that. If, do you want to do that now, or do you want to do
I
that?
think it'd be best to do it in context when you
Okay.
get to that point.
To get to that point?
Yeah.
All right, I agree.
Okay, Ms. Baskin has told us. Ken Bowers wants to discuss virtual versus brick and mortar sessions. Would you like to speak now?
Is there gonna be a time when this is brought up, or
I think there might be,
can we save it for then?
Yes.
yeah.
You may answer my questions or my concerns, but I'll
Okay, and
postpone it till
Ms. Bowers, you also,
Same.
okay,
Mr. Blaine,
then I will keep these right here.
Mr. Blaine, Mr. Adams.
Could we ask Mr. Brown to mute his microphone?
Reverend Brown, can you please mute your microphone on your Zoom?
Okay,
You get a lot of
once
feedback.
I find it, as soon as I find it, oh, wait a minute.
Got it? All right, anybody else? Okay, so we are going to defer the conversations about reopening until we get to that point on the agenda. Next up is our consent agenda. Are there any members of the board who have any questions or would like to have anything on the consent agenda moved down to the action items? Okay. Superintendent, do I have a recommendation on the consent agenda?
I recommend approval of the consent agenda.
Do I have a motion?
So moved.
Second.
Any discussion? All in favor?
Aye.
Any opposed?
You found the button.
Okay, the consent agenda passes unanimously. All right, first up on action items is going to be the hearing and adoption of the 2021 tentative budget as advertised. So at this time, I will open the tentative budget hearing. If our CFO would like to, I would yield the floor to her to present the rolled back rate, millage, and tentative budget.
Great. Would it be okay if I present from here, or do you want me up there? This is okay?
Yeah.
Okay. Well, good afternoon. This is the first of two public hearings on the school district's budget. Last week, as you know, we met to approve the budget ads. The ads did run successfully, meeting the requirements. I was going to show you, but they did run successfully, meeting the requirements of the state of Florida. Our goal today is to continue to meet the Florida statutes, specifically Florida Statute 200.065, regarding properly reviewing the millage rate and the budget resolutions for your final adoption today. Florida statutes requires that the first topic of discussion be the increase of the millage rate, if any, over the rolled back rate. To that end, what is the rolled back rate? The rolled back rate is the millage rate that would provide the same amount of revenue this year as the previous year's millage rate, adjusting for new construction. So this year's general operating millage levy, and the board will be approving these later, is 3.65. That includes a 0.001 prior period millage adjustment, 7.748, which is the basic discretionary millage levy, the 1.5, which is the capital outlay levy, for a total millage levy of 5.898. Now, the rolled back rate is, for the state, 3.5254. For the local, is 2.0867, for a total of 5.6121, or a total rolled back increase of 5.09%. State law requires that when we have an increase, the primary reason for the increase must be discussed. Primary reason for this increase is simply for the increased cost of operations, including employees and supplies, and to reduce the overall operating deficit from the prior year. The budget distributed last week, which was also immediately posted on our website, funds nearly the same operations as last year, except 3 vacant teacher positions were eliminated. The bus routes within 2 miles were eliminated, and we are expected to renegotiate the master degree reimbursement program to reduce costs. So that we reduced, that's about $38,000. The bus routes was about $300,000, and the teachers' positions were about $120,000, and they were vacant, and it was related to the number of students. This budget includes the revenue and expense for the Governor DeSantis teacher pay program increase, but only as a placeholder. You all have not agreed as to how that amount is going to be spent. There are no other pay increases in this budget. The budget in front of you is not exactly as it will be adopted at second reading. Federal grants will be adjusted to reflect the actual approved grants. We will start getting those in probably starting next week. Budget for categoricals we rolled into this budget when we start to know them. As I said, the budget document was presented to the board on July 21st. We've conducted budget workshops in April, May, and June, so I don't think there's many surprises in this document. The FY 2021 operating budget, that is, where you've got current year revenues minus current year expenditures, uses less than $200,000 in fund balance. You would actually see that on page 2, where you're on page 2 of your document, where your operating deficit was $181,820. There will, however, be a lot of rollovers. Original estimate was probably about $2.1 million. It's probably going to be more than that from the 1920 budget that will use fund balance. However, and I will have better data probably by the end of July, early August. But again, this budget maintains all of your required fund balances within the 6% rates as you expected. The final public hearing is scheduled for September 8th at 5:30 p.m. That is the extent of what I'm expected to say to you, and at that point, I'm going to turn it back over to the chair for a public comment on the millage, taxes, and budget.
Thank you, CFO. At this time, is there any public comment on millage, taxes, and tentative budget? Are there any comments from the board?
Madam Chair, Mr. Charlie, you said bus routes within 2 miles. We took out for that? So we're not busing kids within 2 miles?
That's correct.
When did we make that decision?
Okay, can I jump in, please? And I'm not making a political statement by removing my mask. They're not hearing me on the microphone,
Okay.
and I'm far enough away that I can get away with it. I sent board members an email today because we had discussed it, but no decision was made.
Mm-hmm.
So this budget includes the elimination of the 2 mile run, but you can add that back.
So that was at your...
That's $300,000. Mr. McCarthy, if you'll recall, mentioned that he wanted $370,000. The $70,000 was to pay for those teachers who we were going to hope to recruit as bus drivers, and we were able to get a few, but then because of COVID, they could not get trained and the licensing, so we don't need to add 370 back. You need to add back, if that's your desire, 300. And so what you could do is at the meeting, at the vote on the tentative budget, you can amend, you can in your motion say you would like to add back $300,000 if that's what you want for the transportation piece.
Well, I just think we need to have some discussion on this before we just chop
Okay.
that out without the board's consent. I don't know that the board actually consented to that, so.
We caught that, and that's why I put that out, so that we didn't do it, and then all of a sudden you're saying. what happened when buses are driving past students and picking some up and leaving others on the street. I wouldn't want to do it, I don't think you folks want to do it.
No, our
So
phones would be
that's-
burning up, because,
Yeah.
and if we don't know.
Yeah, that's
I mean,
why we
that's-
did it
that's-
that way.
um,
Now, technically, I'm supposed to go over the millage, but we already have that. If we need to, for me to do it again, do I need to do it again? Or can I just make the,
I'm gonna ask you right now for the recommendation on the millage rate.
okay, so I will make, right, the recommendation, let me repeat what those are. The taxing authority is the District School Board of Hendry County. The state rollback rate is 3.5254 mils. The local rollback rate is 2.0867 mils for a total of 5.6121 mils. And the total rollback rate increase is 5.09%. And I will recommend the following millage levies for approval. The general operating millage levy, including the prior period adjustment of 3.6500 mils. The basic discretionary millage levy for general operating, 0.7480 mils. The basic discretionary millage for capital outlay, 1.5000 mils. For a total millage levy for the tentative budget of 5.8980 mils.
Thank you, Superintendent. Do I have a motion?
So moved.
Second.
A second, thank you. Any further discussion?
Madam Chair,
Yes, sir.
I did see in this budget, as I was perusing through it, we have budgeted more for utilities this year than we did in the previous year. I'm just kind of curious why we have budgeted more if our FP&L stuff is not doing what it is supposed to do, or what's going on with that?
One of the things,
Can you identify what line you're looking at?
Oh,
Because
golly, that was
utilities
last-
did go
that was
down,
in the middle of the
electricity did
week.
go down by about 200,000.
In the middle of the week. Let's see if I can find it. I didn't mark the page.
Because if you look on page 8, where you've got energy services, the budget change was a negative 270,000. And that's obviously just the general fund.
I'm trying to remember which page I was looking at. I would have to find it now. I don't remember where it was at.
But I can state that Mr. McCarthy did go over that with a fine tooth comb to confirm that the rates did, or the amount of energy.
Energy
did
services is up.
increase.
Energy services went from 1.493 to 1.677, if you look on page 8.
And that's from, I see, you're looking at estimated actual. I'm looking at the budget to budget decrease. The estimated actual this current year is going to be decreased because of the school closings. So that has caused, it's not going to be that much, we're probably missing one bill. I just saw a bill go through for the month of June. Today, I just saw it go through. So I'm thinking that that's why they all went down because schools were closed. It was 3 months
They went
closures.
down, yeah, our estimated actual
For
for
the current year.
1920 was 1.4, and our tentative budget, though, is calling for 1.6, so that's an increase of $200,000.
But if you compare it to the actual, we're going back to 1819, we're all on the same page, page 8. So if you go to 1819 actual, where you had a full year of opening, a full year of operationals,
Mhm.
That was 1.8 million, and we decreased that by quite a bit, even though, do you see what I'm talking about?
Right, that
So we're
was 18,
assuming-
19, yes.
Right, so we're assuming this year was decreased considerably because for two reasons. Number
Because-
one, we were missing a bill, and number two, the buildings were closed.
Okay, all right. Yeah, I was just kind of curious about why we would be increasing over that, so that would explain that. All right, thank
You made note, by the way, if I may, while you're bringing that up,
Mhm.
we tried to include pages 6, 7, and 8. They kind of tie to what you get every month, so that there's some continuity in your budget presentation.
Is there any other questions, comments on the board? I have a couple, Mr. Carney. I just want some clarification on, page 6. I'm seeing, the first one that really jumped out at me was school board and attorney, line item 9002. And it's talking about 17-18, we're at 2.2 million, 19-20, 3.4, and now we're budgeting 12.3. And that's a huge jump.
Right, that includes two items, great catch. That includes the $8.4 million that's being spent to K-12. And that, in the revenue side, you're gonna have $8.849 million. So the difference is, I didn't do the math, but it's about $430,000 worth of revenue over expenditures for that. The other line that's showing in there is, remember I said earlier about the teachers, Governor DeSantis's teachers fund? That's plugged in as a lump sum within that line item, within that organization.
And then some other areas, like controls and other expenses. I'm seeing, we went from an 18-19 actual of 600,000 to, our estimated actual here was, or for this past year is like 935, and now we're back to a 228,000. I'm seeing,
I'm drawing a blank.
All
I know
right.
this answer, and I'm completely drawing a blank.
and then when I go back and I'm looking through, just the funds here, I'm noticing that, some areas are getting cut and then finances is getting a big bump. And I don't,
Well, finance wasn't getting a big bump. We've got a lot of, where we go?
all right.
No, finance got, looks like $5,000. You look at 90, no, decreased, I'm sorry, decreased from a budget of 575 to a budget of 544.
And this is on page,
I'm still on page 6, is that the page you're on?
You looking at the estimated actuals, Ms. Busey? 504 to 544?
but then, okay, so we have the 18-19 actual, 498, estimated 504 this year, and then 544 in the tentative budget. That is not a decrease.
No, it's a decrease from the budget. The estimated actual, and in fact, I was given a recommendation to not include estimated actual, and I'm still doing it. But because when this was printed, we haven't finished booking the fiscal year. When you asked about year-to-date energy expenditures, we are still getting and paying bills. So that could be part of the reason, is that I'm still getting and paying bills right now. For example, I just paid, we have an unemployment contractor that we pay for last year that just got paid today for last year. And that wasn't even on a purchase order, it was just a payment made.
So our estimated actuals should increase
Right, yes, sir, that's correct.
over,
Do we have to include the estimated actuals? Because that has caused a lot of confusion.
It did, I agree. I don't know.
Okay, all right.
well, but if we don't have those estimated actuals in there, then it's,
Because it's listed as, on our page 2, it's our actuals, no estimated actuals there. And that was, I had questions, but listening to you talk, because I didn't know if we had added in our accrued payables, or, reconciled encumbrances or inventory, because they're,
Great, inventory was Inventory is checked on that one, but as of today, we're still entering data. I expect we'll be making year-end adjustments and entries and accruals probably through the middle of August.
All right, so at this point, I know that this is not in, set in stone, that this is, basically just to set the millage. And, I would like us as a group, I don't like, meeting one-on-one. I think we have a lot to learn from each other's questions, and, would like to come back and because our information hasn't been presented in this manner, in this entirety. And now that, we have, I think, a better chance to look at it and have our questions answered, an opportunity to come back and make some amendments to this prior to having to approve, and send the actual budget up to Tallahassee on September 8th.
I think that sounds great to me.
You want to have another budget workshop then?
Yes, sir. I just think that, now that, we know what the purpose of this is for, and give us an opportunity, because, we really didn't have a whole lot of time to marinate on this document. And, now that we've, I think we're in a position to move forward on setting the millage rates and everything, but have an opportunity to come back together and really look at, where we want our money to go.
I'm okay with that.
Is that, everybody okay with that? All right, so what do we need to do now? Because I think I've heard the board talk about reducing or making that 2-mile radius cut. I just feel like that's something that is
We need to,
impactful to the
First
community,
for
and
village
they need the
I will
opportunity to speak to it.
recommend approval of the tentative budget. It would be appropriate at that time when someone on the board makes that motion to add that back in. Okay, because this is, if you're going to work again on this, no problem, because everything we're doing is, with the exception of the millage rate, the tentative budget is workable.
Yes.
So you need to approve this tentatively
Yes.
with that caveat on there. So if you would at this time, if you want, I need to recommend approval of this tentative budget for the following amounts.
Okay.
First thing, we need to approve the levy.
We need to vote on the levies.
Did we vote on the millage?
No.
No, on the
Okay,
levies.
you need
All right.
to vote on the millage.
All in, we've had our discussion, all in favor?
Aye.
Aye. Any opposed? Motion passes unanimously.
Okay.
Superintendent, do I need to request I just request a motion and vote on the millage, right?
You just did that.
Okay, and then
So
you're gonna
now we're going to
recommend,
the tentative budget.
okay. And now, at this point, I'm gonna request a motion on the approval of the 2020-21 tentative budget.
Let me recommend approval of the 2021 tentative budget in the following amounts. Fund 1, General, $82,301,703. Fund 2, Debt Service, $3,508,707. Fund 3, Capital Projects, $5,915,218. Fund 4, Special Revenues, $19,908,990. Fund 7, Internal Service, $1,570,853. Fund 8, Trust and Agency, $2,767,236, for a total of $115,972,707.
Thank you, Superintendent. Do I have a motion on the 2020-21 tentative budget?
So moved.
Second.
Thank you. Any discussion?
Need to move, put that.
Okay, do I have a motion with, not removing the 2-mile radius?
So moved.
You need to put back, if you desire
Right.
the $300,000.
I make
So-
a motion that we reinsert the $300,000 for bus transportation into the budget.
I'll second. Is that sufficient?
Yes, we're gonna do,
Approval of this, adding the $300,000. Is that the intent of the
That is
board?
the intent.
To approve this tentative budget and add back $300,000 for transportation in the 2-mile zone. Okay, we are clear.
okay, now,
That's fine.
we have a motion on that one. Do we have a second?
I second.
All right, any discussion?
No more.
All in favor?
Aye.
Any opposed? It passes unanimously. And at this time, we're gonna close the tentative budget hearing and proceed to the regular agenda. Oh, here's another hearing. All right, let's do this. So, we are going to have a hearing on the proposed, at this time, I'm gonna open up a hearing on the proposed policy revisions. Superintendent, do you want to speak to that?
Madam Chair, I would recommend approval of emergency policy 1700, mandatory face coverings during
No,
the.
we're not action
Go
items.
back up.
Oh,
B.
Policy revisions.
Oh, yeah,
oh, am I?
yeah, right there.
Okay, thank you. Okay, I recommend approval of proposed policy revisions, policies 0165.3, 4422, and is that a deletion?
Deletion of 4422.
Deletion of 4422 and deletion of 5.
Only 4422 is deleted.
Well, then we should put all of the approvals together and the deletions apart. Okay, so we are approving policies 0165.3, that's my recommendation, and policies 5111.01, and I recommend deletion of policy 4422 as duly advertised.
Yes.
All right, at this time, I'm gonna open up the hearing. Is there any, public comment? Okay, seeing no public comment, I will close the hearing at this time. We have the recommendation by the superintendent. Do I have a motion?
Second.
All right, and a second. Do we have, any discussion, any board discussion at this time? All in favor?
Aye.
Any opposed? The hearing for proposed, policy revisions and recommendations passes unanimously. Okay, now on to action item C, 2020-2021 reopening plans for schools.
Okay,
Superintendent, you have the floor.
Madam Chair, and this is probably what a lot of people would like to speak on. We are required to open a face-to-face school. We can give people choices on whether they want to come to school or if they want to distance learn, similar to what we did. They would maintain their membership in that particular school, but do their work at home. Or a third option, it would be a virtual school, which means they are enrolled in that virtual school. Right now, we would say the option would be HOLA, Hendry Online Academy, or any other virtual school that that parent may decide to do, or homeschool totally. So those are the choices that we have. We have presented to you a work that I have to give credit to the three doctors, Dr. Staley, Dr. Egley, Dr. Mundy, for their work on this to work with the assurance of our special needs and ELL populations and assurances of other sorts for the benefit of our students. I would recommend approval of this. We held this, we could have sent this to the state first. I didn't think that would be the right way to go. I thought that we have a deadline of the 31st. So we had this meeting, and based on the outcome of the board, we have until the 31st Friday to submit it. So is this a perfect plan? Perfect plan, no, but we have not seen perfection since March 13th, earlier this year. So we also have other issues at work that we're gonna discuss and hear about. And you might actually want to hear from some of these people before the board acts, including the guests who you've invited regarding this. Because there are some concerns I have that I want to share with the board. So
Okay.
I would recommend approval, but I would ask that you hold off on your action until we hear from the audience and from the guests.
So moved. He's recommending approval of it. So, got a motion?
Well, you could.
We'll get a recommendation
we could.
after
My
we-
recommendation is gonna be approved. If you wanna make your motion now for the purpose of allowing the discussion, that would be fine.
That's what I was thinking, yeah.
Okay.
All right, we have the recommendation, we have a motion, do we have a second?
Second.
All right, any discussion? Okay, well, at this point, I have, over the last couple weeks, invited 2 people in our county who serve our county in similar but different capacities. The first one is Dr. Joe Pepe. He is the top public health administrator in our Hendry County Public Health Administrator, as well as Dr. Wilhelmina Lewis. She is she's a hometown girl and a medical doctor and president and CEO of Florida Community Health Centers. And so if you two would not mind just coming up here, the way I've envisioned this was just asking questions, kind of roundtable discussion style.
I was begging Dr. Lewis to come up with me, so I'm glad you.
The buddy system will
It
come on
is.
up.
Here, we'll go down together.
No, you actually tried to send me first, but.
See, now you have to put it out there.
Sorry.
How are you guys today?
Good, how are
We're
you?
great. Thank you for, I know you both are extremely busy, particularly at this time, and I just appreciate you taking time out to participate and engage in this conversation and help us better understand what's going on in our community. So I got some information today, and I'm going to ask you, I know that I hear a lot of conflicting things on the news. Everybody hears a lot of conflicting things. What's most important to me is what's happening here in Hendry County and how that impacts our kids. I think that would be echoed by the board. And so I want to get a good grasp on, basically, I guess I'll start with Joe is talking about, how the Department of Health has worked with the district in formulating these plans. The plans have been online, and, I want to ensure, that our plan is going to have good outcomes for our families and our students and communities and staff.
Yeah, so we've been in conversation, gosh, I feel like we started this conversation back in February. We've just talked about it constantly because, just to let you all know, my background is in education. I'm not a physician, so I'm a recovering educator, I guess is the best way to describe myself. So, and I immediately thought about, my days as an administrator and going through H1N1 and all of those things, and we know infection control procedures work, right? But we also know kids are not the best ones to follow infection control procedures. So how do you build in the built environment so that you can be the best environment you can possibly be? And so when we talk about the social distancing recommendations and the cloth-based coverings or any type of other protective measure to mitigate, that's really where the conversation has come into play on busing density and classroom density and feeding protocols and things like that in order to, one, potentially mitigate any spread within, and then also how we would work with schools in the event that a child presents sick or a staff member presents sick or that type of thing, and how would we handle that in order to make sure the parents know what they need to do, protect our teachers, paraprofessionals, administrators, and folks, but also having school go on, right? Because we know there's a significant, profound benefit to education. We know that, especially the socialization part and all the other stuff that happens by going to school. The Academy of Pediatrics also supports going back to school so long as it can be done safely, right? So I think that's sort of where I'm at and where most of us are at. We want school to reopen and maintain some semblance of normalcy for our kids, as well as our staff. But the concern that I think we all have and why we're having this conversation is how do we do that safely, right? So we've seen an increase in COVID spread in the community. What we're seeing now, in the beginning, back in March timeframe, it was really an isolated cluster, cohorts with organizations, migrant housing camps, businesses, things like that. We've since then have evolved as the state increased in case numbers, especially the Miami-Dade Palm Beach area, that influenced our community, as well as we're sandwiched with Lee County as well. And so what we're starting to see, or we are in right now, is what I would refer to as sustained community transmission with household transmission. So there's been some research that supports 10-year-olds and older households have maybe a little bit higher risk of transmission if the child is the one to introduce it into the family. There's some, but the data really isn't solid. It's a very early research study, but the bottom line is we know our kids. From multiple flu seasons, my child has blessed me with bringing home the flu and taking out my entire family, and 3 days later he's fine and we're sick for a week. So we're seeing similar patterns with our kids. Not to say that children don't have poor health outcomes, and I'll let doctors speak to that, but what we're seeing is that the risk factors and concerns are is that the children can bring it back to the family, especially in multi-generational households, where that's a concern, right? Because parents and grandparents and caregivers and things like that, and that's where that concern is with the spread that we're looking at right now. Doc, I'll let you talk about the medical side of things if you like.
Before y'all switch off,
Sure.
I have a couple of questions.
Yes, sir.
Probably more than a couple.
Sure.
We have been tracking this, and like you said, we've been in discussions for a long time. However, it finally hit the schools.
Yeah.
Last week with our summer school, we discovered that some of our administrators were not properly following protocol. So in that regard, that was a benefit, because we could find, I hate to admit it, but we could find where the problem was.
Sure.
And we've addressed that. But when I look at my colleague in Miami-Dade, Alberto, who is saying he wants to see a positivity rate of 10% for 2 weeks, we're at more than 20% positivity rate among the general population, and among those who are 18 and younger, our positivity rate is 19%. Am I legitimately going to be able to open school on the 17th? And I must tell you, I'm a little bit jaded because I had a heart attack about 7.5 years ago. I had to visit my cardiologist for my yearly, and he looked at me and said, if you get it, that's your death sentence. So I'm really not eager to expose myself to this. I'm also not eager to expose not just taking it from families, but taking it to the workforce in our schools, because that can shut us down very quickly, as can, I hope and pray. I want children to be safe all the time, but this is a clear danger to me for the workforce, including those in the cafeterias, because if we can't feed them, we can't teach them. So am I best served to tell people, let's put the brakes on this plan for a few weeks until we can get a handle? Because assuming that everything dropped to below 10% tomorrow, the earliest I can start looking at planning to come back is August 9th. Well, we've already I'm asking the board to extend the calendar 1 week. Do I need to do that more? Alberto was saying he's doing that. He's starting the 31st. I know that, I'll get off my soapbox and let you folks talk. I know that parents want school to start, but I don't want to start and then see a shutdown within a week and a half or 2 weeks. I think that is more, I would rather take the ire and fear from the parents now than to say things are back to normal, but we're shutting down. So I really need advice to make that decision, because that's a very real fear for me, is that we saw what happened at, Clewiston High School had 3 cases that were discovered Sunday. The parents did the right thing and called us because the testing facility called them, and then the health department. Okay, when we compared notes with the health department, and here's the scary thing with me, when we compared notes with them, they cross-referenced the names, and one of those who came to school was supposed to be quarantined because someone in her house had COVID, and the mom sent the child to school anyway. And parents send sick kids to school every day of the world. We will tell them not to do that. We ask them not to do that. So I haven't even discussed this with the teachers yet, but that is one of the concerns I have when I look at the data. Even though our data has been high, I mean, late June it was a little bit low, but now it's finally hit the school, and I'm thinking, what's it gonna look like when we all return? So I'm off my soapbox and want to listen to you folks now.
You wanna talk about medical and I'll talk epi?
Sure.
Okay.
First, let me say, I really honor your commitment to having this discussion and having an open mind about this discussion, because it is really a critical one, not only for the kids in the community. And as she said, Madam Chairperson, that I'm a daughter of Clewiston, Florida, graduated from Clewiston High School. Now have the honor of serving as president and CEO of Florida Community Health Center. We have 50,000 patients around the lake, so we touch every community that surrounds Clewiston, including Belglade, Pahokee, Okeechobee, Moore Haven. And when we've done about 13,000 tests thus far, our average positivity rate overall is about 24%. We're running around 20% in the testing that we do in Clewiston, and that's including Montour Ranch, and sometimes I come out here and help to test myself. So I tell you all of that because I just want you to understand the kind of perspective that I have. I've been working also with Martin County schools as well as St. Lucie County schools in terms of having those discussions around these types of issues there. And the issues that you raise are absolutely spot on in terms of what we're already seeing when we have those kids who are interacting with other people in their family, whether they're multi-generational households, as you mentioned, or just having that contact where even if the kid is not doing poorly, they're coming into contact with a lot of people who are part of the vulnerable populations, whether it's because of their age or their diabetes or their hypertension or the size of their thighs like mine. And those are the things where we're really not seeing good outcomes. And unfortunately, even some kids don't do well. And the concerns that I have most about going into a setting where kids are going to be exposed to each other and other people have already been brought forward. I mean, we see someone where, imagine the child who's in the back of the room trying to tell the teacher, and the teacher can't hear what they're saying. What are they gonna do? They're gonna take off their mask. Masks, I hate being in this N95 mask all day. So what
I was gonna point to him, but I'm not.
No, I'm not trying to make you feel guilty
No,
at
but
all.
I need to do it.
But it's just the
people can't hear me.
reality. It's the reality. I'm accustomed to wearing this N95 mask all day out in the sun doing testing. People don't wear even the cloth face mask correctly. They slide it beneath their nose. You go through any drive-through, they're gonna have it hanging under their chin. And those are the adults who understand the issues with which we're dealing. We're not even talking about younger kids or kids who are socializing. As much as we try to control them, even in usual times, they're in the hallways, they're hanging out with each other. They're gonna eat in the lunchroom together. That's one of the most dangerous locations. And I go back to, how is this disease transmitted? When you cough, you can release up to 30,000 droplets into the air, and a cough will travel, those droplets will travel up to 20 feet. So yes, we talk about social distancing while we're sitting here with each other having a conversation, but someone coughs, and remember, I'm gonna say that number again, 30,000 droplets travel up to 20 feet. If they sneeze, 40,000 droplets travel up to 26 feet. Who's sitting far enough apart to avoid that? Those droplets can float in the air for a little bit of time as well. So we're not talking about airborne spread, but we're just talking about what comes out when we cough or sneeze. And that's one person who can infect multiple people before they have begun to experience symptoms, which means that they have the opportunity to infect other people before they know that they're even already infected themselves. And you have people who, there's a significant amount of asymptomatic spread. So you may have kids or even adults who don't manifest the fever that we're checking for. They don't know whether or not this is their allergies that are acting up in this season. And those can be symptoms of COVID-19 that we won't know about until it's already in the school. You've already got teachers who can't come in to teach. And my genuine concern is that you're going to have to close the school very shortly after you open. I've unfortunately had to go into a couple of summer programs where someone sent their kid in, the kid should have been at home quarantined, and now the entire summer program is closed down. And I've had to go in and test every single person there because the teachers were going between classes trying to teach the kids. All the ages of kids were interacting, and I know that you've had discussions about trying to do cohorts, but it doesn't take a lot to break a cohort in terms of isolation. And I'm sorry for talking so long about it, but I just, again, go back to how it's transmitted and the very real likelihood, not possibility, likelihood that you're going to have to close the school not too long after you open.
A cohort enables us to shut down one classroom rather than one school.
Yeah.
So we're still, you know, we can go to distance learning in that regard. But, Mr. Basquin, I'm sorry, Madam Chair.
Madam Chair.
I will quit talking.
I do have a question though. You're saying that a cough can go 20 feet, a sneeze 24 feet. Why does the CDC only say 6 feet apart then?
I'm talking about not only CDC, but World Health Organization information. So the CDC is talking about, again, if we're sitting here having conversation with each other, that's not going 26 feet. The spread is typically going to happen when an infected droplet lands on someone or they inhale it. It can land on their eyeball. It can land, you know, on their lip, and then they rub their face without thinking about it. They put their finger in their mouth or in their nose, and you know that's how they get infected. So if you're just sitting there having a conversation, that's where we're talking about that 6 feet. But once you start talking about coughing and sneezing, that's a whole different.
Wouldn't it make more sense medically though, if you know, if I can sneeze and it can get to you, why wouldn't they say this thing is as bad as they say it is? We need to stop this now. Let's go ahead and make it 35 feet.
And that's the point of the mask, because it just slows that rate of spread and ejection of the droplets. That's really what it is. I wear this for you.
Exactly.
This is not protecting me at all.
Right.
So the point is if I'm asymptomatic or if I'm incubating right now and I don't know it, and we're having this conversation, I'm protecting you, right? I'm slowing. It's a permanent way to cover my cough. It's an exhaust filter, right? So that's why we've done a lot of education, because a lot of folks, and I'm so glad Doctor mentioned the nose thing, because that drives me crazy. And then so it's uncomfortable, it's miserable, and all those things. The 6 feet of separation is just because it's the most reasonable expectation of distancing, and based on normal conversation under a normal room voice projection, you know, that spread is minimal. But
So with a cough or a sneeze in a regular cloth mask like this, has anybody done a study? How far does it?
There's been several
droplets
different
come
studies.
through?
It captures most of it. There's some side ejection, that type of thing. But again, it's an exhaust filter to help protect you. And the other side is our relationship and interaction is transient, whereas if we were riding together in a car, that's a completely different beast. What Doc is wearing is a filter that's a respirator for herself. It's an intake filter. So it protects her respiratory system, and that's why doctors wear that when they're doing aerosolizing procedures, intubating, if they're up close, asthmatics, things like that. So they protect themselves, but you'll also see them wearing eye protection, face shields, things like that. So that's where those layers of droplet precaution protection come into play. What we're seeing, I'll give you an example, and this wasn't in this county, but I had a case 2 weeks ago now. So we had a daycare where the kids were runny noses, which is typically not a symptom of COVID. They typically dry cough, things like that. So we tested the kids. Kids came back positive, did the exclusions and all that other stuff, cleaned the place. Turns out that one of the caregivers was sick, didn't know it, ended up doing fine, thought it was allergies. Her husband, 2 weeks ago, about 2 in the morning on Sunday, called the ambulance, couldn't breathe. O2 sats were under 80 when he got to the hospital, and has been in ICU for 2 weeks since then. Thank God he's doing okay. You know, everything's okay, but that's how this stuff transmits. So what I'm getting at is with the little ones is they may come home sick and they might do fine. Even mom and dad might do fine, but then you have that other risk. And, you know, based on how many folks you have in the district as far as older staff members and things like that, you know, that's a concern as well. And so, yeah.
And then I've also heard that numbers are not accurate on testing.
So.
Is there any truth to that?
There's been some issues that we had recently where there were some labs that were reporting out only the positives because it was the COVID is considered a mandatory reporting. And so what happens is they're electronically reporting out and they weren't reporting all the lab results, they were just giving the positives. So it was skewing some of the data. The statistics weren't enough to really throw off the overall positivity that we were seeing, but we've since caught up on the negatives being loaded in.
So you haven't heard of anybody that's, like I
Yeah.
heard that there was a couple that went, signed up,
Mhm.
did not ever get tested, the line was too long, they said, forget
Yep.
it, they got
Oh,
a phone call that they
positive.
were called in positive, and they said
Yeah.
it's impossible.
There's a
to do
scam
the test.
going on right now where people have figured out pretty quickly that when we're testing 2% of the population as a minimum goal, that it's pretty easy to do some random calling and get somebody who has been recently tested. And then they do things like, hey, can you give us your name and date of birth? Because, or let's verify your address. We have your test results. And next thing you know, they're freaking out. Oh, I'm positive. I had a person that was in an assisted living facility, did the same thing. And we ended up working with the management and law enforcement because we were concerned that there was an identity theft that occurred. So they're targeting our most vulnerable, playing off of this. So we put out a press release on that just because there's been lots of bad actors doing this kind of stuff.
So you don't believe that actually there's any truth to any of that?
There's lots of rumors, right?
Right.
So that's one of the situations that I know of where people are getting called. When we call somebody with lab results, it's usually the physician or a nurse practitioner or somebody, a designee to work with that patient. So there's a client relationship. If we call them, we already have the information, so we're actually validating and they're confirming, right? So we don't need to know their street address, we already have it, and that kind of thing. So that's a lot of what's been happening, quite honestly. There's a lot of bad actors out there right now. We've seen the same scams with protective equipment and other things as well, so unfortunately. Let me talk about testing for a second as well. There's been lots of questions about, in fact, I even had this question today. If somebody gets tested today at my place and tomorrow at Family Health Center or Florida Community, is that counted twice? And the answer is no, we count them as a case, right? I've had people tested 9 times, so it's a case, it's a single case. Another question is if somebody gets a nasal swab and then they do a blood test and they get antibody test, is that counted twice? No, it's still counted as a case. What we are doing, that's been a recent addition, not recent, probably about a month ago, is we've included antibody testing into the overall case count because we feel that if somebody tests positive for antibodies, we know they've had it or had an exposure, right? So we're counting that as a case regardless if they've been ever tested positive previously. So that's helping to make sure that those numbers are more accurate, just from a case count perspective.
Can I add
Yes.
something else? We have close to 1,000 employees across the district, teaching, driving buses, paras, administrators. Take 20% of them out because that's what our positivity rate is. Just assume 20% of that, so 200 people could be out in one day, and that could average 15 teachers out per school. What are we gonna do to even attempt to begin socially distancing the people? Our employees range from an age of older than 65 to some are not even 20 yet because of the jobs we're doing. Our teachers, of course, are 22 on up. The average age of those testing positive in Hendry County is 37. So that means half of them are older and half of them are younger. And our people who we employ have a range of medical conditions that we could be, at first, I've got to admit, I thought this is just a bad cold. It's just a bad case of flu until I heard somebody breathing who had it, and I thought, they're not gonna make it. So it impacts people differently. We've had other employees in the district who've suffered from this summer. Some were just incredibly tired. Others felt as if they had been playing football for 3 weeks straight because of the body aches and pains. And then we had one hospitalization where I didn't think, it just did not sound good. So I've always been worried, and I really need I mean, I don't need you to tell me what to do, but to tell me, am I thinking correctly before I make a final motion or recommendation to the board on what we can do?
So what I've seen, and I'll defer the rest to Doc, is several school districts have already gone with the decision to delay to the end of August, just to give themselves an opportunity. Charlotte, I think, Collier, I believe, also did.
Sure. Collier's is going 2 days later than us. Lee
Okay.
and Charlotte are
Or
going
31st.
August 31st.
Right.
Dade is going August 31st. Palm
Right.
Beach is going virtual.
And I think the reasoning for that is a couple of things. One is to see the trend in which this thing is going, as well as giving the teachers and administrators more time to kind of get the infection control piece under control. One of the things that we're adding to it as well is our incident management team is, we've been doing infection control visits at nursing homes for several months now. We're putting together protocols now to ramp that up for schools as well to kind of help with that piece. So, I'm sorry, go ahead.
I'm in total agreement. Our thinking is aligned in that I believe that some of the benefits that children could get from schools, such as the socialization elements, can be accomplished in other ways. My biggest concern right now is just the risk to their physical health and the health of their family members and community. And I think right now, with the degree of community spread in this area, that it is dangerous to go back to brick and mortar school at this time. And I would definitely want to see a trend of decreasing percentages of positivity as well as decreasing number of cases over a period of time, whether that's a 14-day period and you utilize the CDC gating criteria in terms of phased approach, or if you utilize another methodology that takes into account the degree of community spread before going back into the school.
Now, if we were talking about daily rates back in March, this would be a very different conversation.
Yeah, very much,
Yeah.
yes, very much.
So our target range is the 10% positivity,
You want to keep your
Below
overall rate of spread under 10%.
under 10%, and we've
For-
got,
For 2 weeks.
for 2 weeks. And so we're at a 19 here.
For kids.
For kids,
For 21%.
and a 21 general. When I look at the numbers, it says Hendry County has 1,589 cases. Are those active cases?
Yes. No, that's total
In
cases
total
since the
cases,
outbreak.
all right. And that positivity rate, is that like, is that an average of the month, or is it on a weekly
So there,
basis?
if you look in the dashboard under health metrics, and I can certainly go over it with you, there's a line graph that you'll see that shows the positivity rate by week. What that is the results of that week's tests and what they're resulting in positive. We use the positivity rate to identify that we're testing in the right places, I think is the first thing. So if this were HIV or hepatitis C, we want to see a high positivity because we know we're hitting those at-risk populations. But because of the random amount of open testing that we're doing collectively between all of our organizations, statistically, what that's giving us is a better representation of how much COVID is circulating in the community. And that's kind of, so the more numbers we get statistically gives us a better sample for understanding what spread looks like. Did I say that right, Don? Okay.
Does anybody want to talk now?
Everybody can, right?
Why don't I go through the list? Ms. Stitt, would you like to speak at this time, or do you still want to wait?
Sure.
Do you mind if I turn just so I can see?
Yeah, please.
So, the governor and the commissioner of education have really sort of insisted on these brick openings. In secondary, it's almost impossible to social distance in a classroom with not dividing the students up into cohorts that come on certain days of the week. Physically, just inside the rooms, it's impossible. I measured my classroom, if all of my students showed up, 23 students showed up, they have less than 12 inches apart between desks. That's the physical space of the room. I've met with Mr. Paletti so much this summer. I feel like we've texted and called and met face to face on your vacation, my vacation. And, you know, in a perfect world, we'd go for separation, hand washing, mask wearing, all those things that we know help kids at a lower percentage rate.
the state has sort of tied our hands and not allowed us to divvy up our secondary students like that, or divvy up our elementary students to get more distance in the classroom and separate them. So we are left with bringing back our kids and taking out one major area for secondary schools, which is distance, because we can't give it to them in their classrooms. You're gonna address the second, area of that, the third leg of it, which is mandatory face masks, which is a whole different discussion of whether we'll make kids wear them and should we make kids wear them, but it's part of the safety protocol, right? So, and then hand washing, of course, I think we can take care of with our stations and our sanitizers and such. But we're just not prepared, and we don't have the flexibility at the state level to do some accommodations and modifications here in our own district because of their dictates of how they want school to roll open. And we do have, because I was just on a virtual chat with and so were the two teachers behind me, with over 100 of our teachers from Hendry County last week. And their biggest fear is that they do have underlying health conditions. They're not requesting that Mr. Paletti put them on virtual leave because they're trying to protect those positions for people who are in the most critical need. Okay, maybe recovering from cancer treatments, or have an active critical illness with treatment going on right now. But I've heard from asthmatics, we have diabetic teachers, we have teachers with heart issues, we have teachers with immune deficiencies, Hashimoto's disease. We have teachers who are willing to come back, but they're incredibly worried because we don't have all the things that are recommended as common recommendations, not even the most, innovative or challenging, just the commonality of these things we don't have ready to go. So they are afraid. Several said if masks are not mandated, they're not coming back. If we don't do something about distancing kids in classrooms, they're not coming back. And it's not because they have all of a sudden changed their mind about teaching. They love their kids, but they are worried about being there for their own kids. Sorry.
No, I just want to dovetail into what you're saying. That's not just an idle threat. These are statements from teachers who have 28, 29, 30 years in. They're 62 years old. They can retire in the morning. And that's what they're telling us they're gonna do. And I have no reason to doubt that that's what they're gonna do.
How much of a change do you think has occurred from the first teacher staff survey? The teachers and staff, when the initial survey came out, who indicated they were wanted brick and mortar as opposed to like where we're at today based on our community specific data.
We discussed doing that again, but our fear was that parents would resubmit multiple times, or if they haven't. That I would almost rather, if we want to do that, let the schools do the calling of their parents to say, here's what's going on. But the other issue that's at work, we know what we're talking about, but the local media is not, the news press, you can't understand, Palm Beach isn't necessarily covering what's happening in Hendry. So we also have a huge language barrier. So we have a total number. I'm not opposed to redoing it to see how it's changed, but we need to figure out a better methodology. Not everybody has access to a computer, all of those, which might be the population we need to address really strongly, be worried about what they think about this. So I don't mean to interrupt you. I just wanted to add that these are not threats by people saying, I'm just not coming back. These are dedicated Hendry County employees who have the years in, who could retire in the morning and say, I'm not coming back.
So I do have a question. How many people have we had with this enrollment process that have said we're not putting our kids back into school? Have we had a dramatic drop?
It's running about, at the last time, 40% coming back, 30% saying they want distance, and then the remainder virtual. But what's happening is we're finding out that the parents were confusing option 2 with option 3.
Okay.
So more people are moving into option 2 and not option 3. When they just thought, well, if it's still that unsafe, I'll just keep my kid home and we'll do what we did in the spring. And that's when they said they would do that virtual. So it's not really that
So if we've got
much.
40% that are coming back to our schools, and we have this population that is vulnerable and concerned about that, those are the ones we need to let them teach the virtual side of things, and the ones that aren't scared to do it. We can't live our life in a bubble. I mean, we just can't. We've got to move on. I've watched a lot of things. I don't know how many of you have heard of the frontline doctors. I'm sure some of the medical people may have, but there's a lot of stuff out there. There's thousands of doctors involved in that program right there alone that are saying the media is scaring people a lot with this stuff. It's serious. It's a serious deal. The COVID is a serious deal, but there are more scare tactics involved than some people realize.
My data is coming from the state, not from CNN or Fox or anybody like that.
These are frontline doctors, not.
I'm a frontline doctor.
Right.
And what I have told you today is what I would stake my life and my family members' lives on. It is not a scare tactic for me to say to you, in all truth, that these children and their family members will be at risk. The way that it's transmitted is just the way that it's transmitted. And you're gonna have somebody who's not gonna have their mask on, or it's not gonna be on properly. They're gonna cough, they're gonna sneeze. My best friend just came home and buried her aunt because her cousin came to visit. And she didn't take this seriously. Her cousin killed her aunt.
Right.
She, not intentionally, but that is the truth of the matter. And once we get this wrong, there's no going back from it. There's just no going back from it. And it's not sensationalizing it for me to just tell you that's just the truth of it.
Right.
I come out here on Fridays to Glades, and I'm out here in 90-degree heat, PPE from my head to my toe. I feel like I'm melted almost by the end of the day. If I take this mask off, I'm 3 different shades. And I'm the CEO. I could be sitting in West Palm Beach in my office, but I come because this community matters to me. I go out to Montura and stand in the blazing sun because this community matters to me. This is where I grew up. My family's here. My friends are here. And their lives are at stake because of this disease. And this is what I see every day in our 52,000 patients and all of the communities that we serve. So I'm just telling you what I see from.
Well, I can't disagree with you, but that, to me, I look at it as you can't live your life in a bubble. And when you're sick, it's just like what he had mentioned earlier. You have to take responsibility. Keep your children at home. You stay at home. You do the right thing. But there's people out there that want to continue to live life and do it responsibly. I think we need to give them that option as well. So, how can you cut them off and put them in that bubble?
All right,
We missed it.
Mrs. Stitt, we were on your question, and then we hijacked it, we're sorry.
I would just say into the questionnaire that was sent to teachers, staff, parents, the wording of those questionnaires is extremely important. Because one of the questionnaires that went out was, what would you like to see for the return in the fall? Well, everyone with a brain would want to see us all return to our normal life. That is the hope and the wish. But do the parents, do the staff know that we are at 21%? That we are at 19% under 18? That do they know that? And then with that positivity rate, do you feel comfortable opening schools? The question has to be crafted to really give parents information and let them make the decision based off the latest information, because some people don't know, right? And I will say this about teachers. Half of our teachers maybe half of our teachers may think like Mr. Basquin, but the other 50% of our teachers do not. And it is very easy when you are not the person in the school every day, coming into contact with 150 students or 30 students, to say, we just need to live our life. These people are afraid. I hear it every day, from sun up until sundown. They are afraid. and they want some kind of guarantee that Mr. Paletti can't give them, the doctor can't give them, that I can't give them, that you can't give them. And if you really want teachers to call in and go to virtual who are afraid, then good luck running your schools with 50% or less teachers. It's not gonna happen. They're afraid. Some are not. At least half of them are. So, I just think they're the people that are gonna be in with those children. They're worried for themselves, they're worried for their students. They're worried about what happens if I catch it and I can't be there for my family, or my student catches it, and God forbid, I feel terrible. I mean, the state of Florida is gonna let kids play football. Think about all those kids going to football, playing football, and then coming back into our classrooms. Let alone all the kids sitting on the bus together, trying to separate them the best that we can with what we have, but not a perfect scenario. Teachers will do whatever the board decides. If you open the schools, they will be there because they are always there. They're there when we have mass shootings at Parkland. They are there the next Monday in their classrooms, no problem, and they will come for this. But there is a fear there that I think you should know, from their perspective.
If I could break on teachers for a moment, they're there now.
Yeah.
Okay, teachers are there now, and of the almost, we might be at 500 teachers in this district, there are only 8 who have given us the doctor's notes who have the chronic serious conditions. So the rest of them are saying, put me in, coach, and we plan on doing it, but I don't want to be the one to say, you 40 are coming in, because I'm willing to risk you, because most people act responsibly, but there are those who don't. And I don't want to be the one to say to you 40, because we have young people who teach for us who have major issues, major health issues. And it would be devastating for them. So let's let were you done?
Yeah, I was just gonna say, we don't have any testing. We don't have testing. I would love to see testing in these pre-weeks before kids come back to let our teachers know, have you had it? Maybe you had it and you didn't even realize that you had it. Maybe you have it currently and you don't realize that you have it. You know,
What good are the tests if I test today and I'm negative today, but 2 days from now, I'm in Walmart and then I contract it. My results come back from that test saying I'm negative, but in all actuality, I just picked it up 3 days after they nose swabbed me.
right, but at least you have a baseline. At least you have a baseline of where your staff was prior to opening up. At least you have a baseline, right? And it can change, but it can also show upticks in change, right? So if our teachers start coming down with it more and more and more, and we were all at this baseline, then we show a trend where we're trending upward in the.
Madam Chair, if I may
Yes,
just talk about testing. So the strategy with testing is really a statistical surveillance, and the gentleman was correct. What we're seeing is some of the pushback that we get often when we test is we go through sort of an algorithm, and we ask the person, were you around anybody, et cetera, do you have a reason to believe your health has changed, and stuff like that. We're testing everyone just because we want to make sure that we're capturing everything, but realistically, if you test too soon, you can get a negative result because the viral load hasn't increased enough for the test to be significant. So then the person says, oh great, I'm negative, I feel great, it was allergies or whatever, when in reality they're spreading it to their whole family. So that's a problem. So some of the conversations that we've had already with our health department as well as our partnership with you all is how do we embed surveillance testing in the schools on a regular basis? How do we support pediatric testing, because that's going to be a major gap in, and clearly a surge as schools reopen. So we talked about different things like, partnering with our friends, but also protocols as far as do we get consent early on in the school year as kids come back, so that if a child is symptomatic that meets the criteria based on protocols, we collect the sample there, so this way we can kind of speed up that timeline, and then the health department would cover the cost of the test so that we could help expedite getting the information. Another piece what we're looking at is the rapid testing really isn't an ideal scenario, but sometimes there's a need to know, especially with high-risk scenarios, especially, no offense, but potentially a super spreader. You know, if you think about how many people that Mr. Paletti speaks to on a daily basis, and if he all of a sudden became positive, just the contact tracing alone would make my team probably quit. We've had cases where one person, we had 30 contacts, so you can imagine how difficult that could be. So that's the testing strategy and some of the things that we're talking about, because I think we need to maintain a level of surveillance even as we move forward, just so that we understand, are folks testing in safe, are we testing on a regular basis? And we're doing that with our teams, our own staff and things like that. In nursing homes, we're testing on a regular basis just to maintain that surveillance and catch people earlier. So I just wanted to add that in because it's a valid concern.
May I ask how quickly are you able to get test results back out? Because we're running, the lab is taking up to 8 days for us to get a result,
Right.
so
it
slows
varies.
down everything.
It varies on lab. I have folks right now that are waiting almost 3 weeks from Quest. So Quest varies, right? They have the capacity for 20,000 test processing a day, but when we're testing that many people, the labs get overwhelmed.
I had
So-
it done, and I had my test back in 4 days in Lavelle.
That was earlier on in the process,
Correct.
we could get them back in 24,
Yep.
48 hours. Last couple of weeks, I'd say, it's now gone up to 7 to
Mine was
8
7 days.
Yeah, so that's about average, about a week. And so the challenge with that is we operate under presumptive positive. So, and that's why we do the questioning. So if you feel there's been a change in your condition, if you were a close contact of a known positive, things like that, then we operate under, you need to isolate, get better, regardless, and we'll wait on the test results. So that's where that presumptive positive, we assume you're positive with COVID until you get the test result back. And then if it takes a week to get back, then realistically, you're only 3 days away from getting cleared anyway. So at least you know what you had, but then you're doing better. So it's not the best scenario. Ideally, it would be a rapid test and get the answer in 5 minutes, but we're not there scientifically yet.
Robin Basquin?
Okay, so you said only 40% said they want to come back to school. The students are only 40% are signed up to come back so far. So if half those teachers are scared, then half that is scared can do the online teaching. I think that'd be a good idea. But I've talked to teachers who are also parents. One of the teachers has 4 kids, 3 of them of which are in school. Her and her husband are both teachers, and her concern is if it goes completely online and she has to be online with her students teaching for 7 hours a day, who's watching her kids? Who's helping them with their schoolwork? They're in elementary school as young as 3 years old. One of them is special needs. He can't sit on a computer all day, especially not by himself. So I know that's a big concern, is that there are special needs and ELLs who don't have that help at home.
Yeah, and
So,
those populations have different, when we look at our plan, it might be that certain special needs students come to school anyway, because that's where the services can be.
right, but if it's,
And the same with an ELL student, that might happen.
right.
We had a discussion like this, similar to this discussion with our principals today. And staff members, for instance, would be able to bring their students in, not for instruction unless there's somebody there who can instruct. But that's a major concern, the childcare. The whole thing about opening schools is about childcare for people to go back to work. So we are slowly crossing each bridge as it comes up. But when we cross a bridge, we have 3 more that we need to cross. And we're not seeing the end of the journey. So it is a very complex issue.
Right, and you also have those students who had to complete their classes online in the spring, who just they don't work well online. They need a teacher in front of them, they need to be in
And
the
we
classroom.
understand that, and those students, that's why we built into the plan that if you are on not a virtual, but if you're on a distance learning, it's reviewed every 4.5 weeks at the interim mark, so that if we see that the student's having trouble, we would be able to talk to the parents, say, we're heading for a crash and burn, we might want to try something else. So it's gonna be structured differently than what we did in the spring, because in the spring it was like, you have to do it, here's what you do, so we had no time for thought. We've learned some lessons. So what's gonna happen is that those students are gonna have a regular schedule with a particular teacher, and the teacher will then be in contact with those students on a regular basis. And it will be done that, like, unless you're one of the 8 so far who have said, I need to work at home, that teacher's gonna be at school,
Right.
implementing the lessons as they go through. And there'll be a lot more supervision, a lot more contact with those students, because you're right. You know, I would hate to see a test of, I would hate to have seen the FAFSA or the FSA being given last June,
Right.
because there was a drop in learning, and that's the other issue that we need to worry about, is to start bridging those gaps.
Right.
So, yeah.
Madam Chair,
Yes, sir.
I do have a question, Mr. Pletty. With those teachers that are doing the distant learning, or, you know, doing the distant teaching, are they also teaching regular class as well? For, if we're brick and mortar, are they doing a
Let me talk
conjunction?
about that, because we've had to deal with that. That would be a backbreaker for teachers.
Exactly, oh, that was my
Okay?
concern.
So what would happen is, suppose I'm a middle school social studies teacher, which I used to be, so that's what I'm using that. I would have up to 150 students in my class. Suppose 30% of them are gone.
Right.
So that 45 are out. What we have agreed with, and Ms. Stitt's here so she can correct me, I could, as the social studies teacher, give a lesson on my book. The student has a schedule, okay, so I could use the Google platform to do the lesson. The student would log in, we would be tracking attendance, which we did not do in the spring. So we would be able to do that, but this teacher is now worried about the other 70 or so % of the students in his class, or her class, okay? There will be a change. There will have to be, in the middle school and the high school, we have classes that are called singletons. That means we only offer it once, okay? That might be a physics class or a high order math class where you really have one teacher and you only have one period of students in that class. That teacher might have to be doing it at the same time. Okay, so offering instruction online and virtually and live. But we will cross that bridge when we get there, because at this point, we really truly don't know how many people are signed up for what until the day of school. And you sort of have that anyway, who shows up. So I have another feeling is that there are those who said they're not gonna show up who are. I don't know that, just empirically, I feel that. So that the teacher would not be teaching, I would be responsible for my students, but not necessarily anyone else's. If it's an elementary class, we might be able to group a class of 3rd graders together, and that teacher takes those virtual students or those distance learning students. But if I'm teaching 3rd grade, it's not the plan for them to also have the students who are doing distance learning and the live classroom. That's double dipping, and that dipping, that will really be difficult for teachers to handle.
Yeah, that's
And we have
overworking them
talked-
big
we've talked
time.
through numerous hours.
Yeah, that's why I was asking, because
Yeah.
that is gonna be really
So-
tough to make, they're like they're teaching
Robin, did you have
16
anything
hours.
else? You're done. Ken Bowers.
I have agreed with everybody in here who has spoken, and I'm so confused now, I don't even know what.
Welcome to my world.
Everything, I'm gonna call you Wilhelmina, because I'm at school. Everything she said, it scares me to death, and I agree with, and I believe. Everything Mr. Basquin said, I agree with, and I believe. I believe. Mr. Paletti, you teachers, I don't even have a clue anymore. What I will say is, we were parents during the virtual learning at the end of
Shutdown,
the,
yeah.
right, from March on. I'm glad to hear you say that that was just kind of, there were a lot of mishaps that y'all were just thrown into this,
Yeah.
and you just didn't have a clue. We as parents were thrown into this. We sure didn't have a clue. What our main concern was, is when I walked in here today, I was 110%. My son's gonna be a senior this year.
Yeah.
He needs to be
Yeah.
in school, in a classroom, with a teacher. This is a critical year for him. He needs this for the next level of education. But he needs to be alive to get to that next level of education. I'm not gonna say that the virtual learning was a nightmare, but it was a bad dream.
Yeah.
It really was. It was instructions coming to, we're gonna say the student, my son, that were very vague. And it would take sometimes 2 and 3 days to get a response back. Well, but listen, I promise you one thing. I am not in here bashing teachers. My hat's off to y'all. I respect y'all for the career that you chose. You've got a hard job without the COVID. I worked in a prison for 27 years. Your job's probably as difficult or close to as difficult as mine was. But it was very confusing. My daughter is newly out of high school, 5 years back or whatever, just finished college. So she's actively involved in learning. Fortunately, she was, I would say, 60% of his teacher at home. We're not teachers, and my daughter's not a teacher, and we all struggled. And my son, who was a junior, had a sister, an adult sister who lives at home, who was on top of the curriculum. And a mother who is no dummy either, but not a teacher, who was on top of it, and then disciplinary and that. It took all of us, and it was confusing, and it was difficult. And all he did was complete assignments. He did not learn anything. But I'm here to tell you, I don't know what to do. I mean, I was shoving him into the schoolroom. When I walked into this building, I was shoving him into the schoolroom. And I still want him there. I really do. I'm probably going to lean towards sending him and just hope and pray that, because he's not going to learn at home with us. He's not going to virtual learn at home with us. I'm sorry.
Would it be best in your situation if I asked the board to extend the opening past the 17th?
Okay, let me go one step further. I was going to tell you, I remember when I was in school and when we were in school, school didn't start till the first week of September, because I remember that we would go to school for like a week, and our first weekend off, we had a 3-day weekend because of Labor Day. So, can I ask Wilhelmina, I know you can't see in the future. What do you predict? I want your personal prediction. Where do you see this in 4 weeks?
So,
I really think it depends on what the individuals in the community do in terms of.
You're seeing what the individuals in the community are doing now, and they're doing nothing. So based on what you're seeing, based on the numbers that you're seeing every day, based on what you're seeing in the community and the public when you go into it, what is your prediction? Where are our numbers going? Because I'm going to tell you, I'm a high school graduate. I went to a police academy, and that's all the education I have. I predicted the secondary spike. I predicted the secondary spike before we even had our first spike. I said, oh, they're going to get it under control. The numbers are going to dip. And people are going to run right back out because the tigers are back in the cage. And guess what? All the tigers aren't back in the cage. They're still out there, and they're still attacking, and they're still grabbing people and killing people. and we had this secondary, now this secondary spike has been way more than what I thought it was gonna be. But where do you, I mean, in 4 weeks, say we postpone this until September, first week of September.
I can talk a little bit about that if you want to talk.
No, go right ahead.
So.
Can I jump in here for a second too? And I want to mix it up with
And I don't mean to jump, did I take
with
some of
your
your
statement, Mr. Bowers.
I'm
You
sorry.
know, so I'm familiar with the Department of Health portal, and I love data, and so I'm perusing that, and I'm a comparer, because I don't like to be happy, so I love to compare things. And, but, you know, what I'm comparing, you know, our per capita data compared to our neighboring counties, because, you know, it was very shocking to me. In Hendry County, everything's been like, you know, clearly our data is not great, but the message has not been it's not great. And so, you know, when I'm headed over to the East Coast, when I'm greeted by a sign at the South Bay city limits that says, high COVID area, wear your mask and wash your hands, you know, that's a level of messaging that we haven't had in Hendry County, despite our pretty terrible data here. And so when I was, you know, doing my comparing, you know, I've sat here and listened tonight, listened to a lot of things. What I've put together is, you know, we've talked about, I'm just trying to write stuff down, August 31st start dates for Charlotte and Lee County, Dade County too, was that it? And then Palm Beach County's going virtual. When I'm looking at their pediatric COVID rates compared to ours, Dade County, they're struggling. But Broward County, Palm Beach County, and Lee County, all bordering neighboring counties, they have better pediatric COVID rates than we do. And they're saying, hey, let's hold off until August 31st. And it's, you know, it's just when you're starting to compare our rates against theirs and their decision-making processes and the you know, the people that they have helping and compiling this to make good decisions, because ultimately the decision is we do want our kids back, we do want life back to normal, it's got to be as safe and as you know, and be able to mitigate that as much as possible. I've seen some outcomes here that I want to share in Hendry County just based off of data, just what I'm looking up. You know, 9% of our positivities or positive cases in Hendry County have been hospitalized. And
Say that again?
9% of our people who have tested positive in Hendry County have actually been hospitalized. That's up 3% over the state average. And so those are things that make me wonder, access to health care here, the demographic, you know, people who have the transportation to get to health care. Those are concerns. 2% of our cases, positive cases in Hendry County, have resulted in death, and that's, you know, that's a 1 percentage point above the state average too. I have my questions for our medical doctor here is, and even Dr. Pepe referenced this, is COVID-19. And I want to know how that compares. Like when, you know, we've had H1N1 come, you know, blow through before, whatever, you know, people got rattled by it, and bird flu, and there's been other viral outbreaks. But, and I guess as far as severity of symptoms, you know, how does this compare? You know, what were you seeing in viral outbreaks in the past, as far as severity of symptoms with children and adults, and how's that comparing to what we're facing here with COVID-19?
Where do we start? So let's talk about reproductive value. So there's a statistic that we use called an R0, which is the reproduction rate in which a virus can replicate. So if you have one virus, the probability of having additional cases, right? COVID, when it first broke out, was somewhere around 3. Give you an example, measles is somewhere around 11, and influenza we're seeing somewhere around anywhere from 0.5 to a little under 1, 1.5, 1.1, somewhere in there. So this virus is definitely spreading faster than influenza. We don't fully understand all of the long-term health implications. We're seeing interesting things that are scarring in the lungs. We're seeing inflammation responses. You're seeing things that are called COVID toes, where you're having coagulation issues, vascularization problems. And they think that's linked to some of the sensory changes that are happening with people. So they really don't fully understand the full implications of what COVID is. Initially, we thought it was a respiratory disease, but we're seeing that depending on the age of the person and their underlying condition and some receptors we're finding out and levels of those receptors, what their symptoms may be. We had a person who we treated with a Z-Pak and a sinus infection. They're mad at us because we said, you're still positive, you need to stay home. And then we've had other people on a ventilator. So we're still trying to understand who is at risk and identifying that. We know that there's comorbidities and underlying health issues. But this is not flu. This is a very different beast. We have patients that, what we're calling happy hypoxics, where they, typical oxygen saturation levels when your lungs are working properly is above 94. And we're seeing people saturation levels at 80, and we ask them, how do you feel? And they're like, oh, I feel okay, I just, a little tired. And and they're not showing the same symptoms that you would see somebody who has severe respiratory issues. And so what's happening is those folks who may just feel tired or whatever, their oxygen saturations are down, that causes a whole set of issues Doc can talk about more, but then they crash very quickly. So you can have somebody you're talking to today and then hours later they're expired just because they decompensate that quickly. So those were some major lessons learned that are very different than influenza. Again, influenza, we have a vaccine. So that's another component of it as well. So that's a challenge. There's lots of good promise with vaccines, but the latest one I saw was out of Oxford, which showed some promise, but we're still months at least away from that component of it. So it's gonna take us some time, but COVID is absolutely not the flu. It is a different beast completely. Doc, if you want to fill in.
And we did not talk before this.
No, we didn't.
We haven't seen each other in a while, but I agree with him. I remember last year around, when flu season starts, I'm always the one that says I'm the first one to get my flu shot.
Mm-hmm.
And I tell people that flu kills more people every year than breast cancer does. And so I have a healthy respect for the flu, but this is a whole other beast. If someone gets the flu and most are going to survive it, they'll have potentially some shortness of breath and fatigue for a while. But for us to have really been experiencing this since March, and think about how few months we are from March, and to already see people who have what I would call chronic lingering effects from this, that we don't know whether or not they will improve. We don't know enough yet. We're finding new symptoms, new presentations. As he mentioned, the lung scarring. How long have we known that people get permanent lung scarring from COVID? Has it been 2 months yet that we found that out? So the more we learn, the more I realize it's very different from the flu. We used to say, okay, you're right. The respiratory illness was the issue, the worst issue. And then you found out that, they have clotting issues. So they almost have like a response where they're in a clotting cascade when they're in the hospital. And so there's just still so much, unfortunately, that we don't know. But we do know that, unfortunately, a subset of people will have permanent damage to their body from this, which is something that you just don't see with flu.
Right.
And it's just, it's never the way I wanted to learn about a disease.
Amen.
Can you,
let me speak first?
my question, where do y'all see us in 4 weeks?
So,
Not just us, but where do you see this COVID in 4 weeks?
So all of the models, and I really wish I had a computer here to show you some of the models, but if you want to look at some of the models, Washington State has a really good COVID model that's been out for a while. Hospital IQ is another one that really a lot of hospitals use to kind of do some data mining. But when you look at those models, you'll see that initially they kind of trend slightly upward, just like we're seeing right now. Maybe even some steeper areas depending on what state. And then you have basically two diverging lines, okay? And those two diverging lines are projected paths. The projected path on the top is with restrictions lifting, and the path towards the bottom is universal masks, so increasing conditions. We know that we suppress the virus, and maybe in some ways we did such a good job at it, like you said, the tiger's back in the cave, and everybody's like, hey, I'm good, I didn't get it, I don't know anybody that got it, because it worked. The problem is the psychological, economic, how long can you sustain, and that's the challenge. So our strategy has always been to keep the system from getting overwhelmed so that everyone can get the medical care they need, so you don't see like what happened in Italy and other places, so that we can sustain long enough to where there's another medical intervention to help, such as a vaccine. And then also, if we can keep it to a simmer, not a boil, we get to herd immunity safely, right? And what herd immunity is that there's a condition that occurs when enough people get a virus. At some point, you'll see the number of cases drop off because there's nowhere for the virus to jump to, because we've all been exposed. It's kind of like when you had the flu in your house, once it's burned its way through, you know you're good for a little while.
But didn't they say we can catch this twice now?
Not necessarily. So COVID, or SARS-CoV-2, has about 70% of the SARS. Oh, I don't know, I thought it was an alarm, I thought we had to leave. Sorry, it's been a long day. I was like, so SARS-CoV-2, which creates COVID, it has about 70% of the SARS, or the SARS virus. And what we know from the SARS outbreaks in Canada and elsewhere, we've been doing some longitudinal studies for immunity, and we feel this is gonna act more like SARS than like flu. And so what we've seen is with SARS, I want to say it's 10 or 11 years out, we've seen people with immunity even that far out. So we feel that immunity is going to last a lot longer than an influenza. Where the conversation comes out where people become positive again is what we're seeing, and that's where the new CDC guidance has come out, where they're not recommending testing right away just because your fever has passed, and so you're not infectious, but your body is shedding the virus still, and the tests are picking up parts of the RNA of the virus, which is triggering a positive, when in reality you're not infectious, it's just detecting the virus. And so that's where you've seen people linger for 6 weeks, and they're like, I feel fine, will you please let me go back to work? And that's where the CDC guidance has changed dramatically recently on the 20th. They put out new guidance on that so that they do not recommend testing right away. Monitor your symptoms after you clear, after a certain period of time, then move forward. So that's where that comes. So where are we headed? If we can keep our infrastructure stable, there's enough remdesivir, there's enough convalescent plasma, that's blood from people that have cleared the virus so they can help others get immunity and fight it. If all of those things, and we have enough ICU beds and we have enough staff in place in order to support and enough ventilators, then we can keep this thing at a simmer long enough to where 60, 70, 80% of us get it, or we get vaccinated, something comes out that we can develop immunity, where we'll start to see that come down. CDC, when we looked at hepatitis A outbreak, if we did nothing, they said it would take 18 months from the time it began to when we start to see it simmer down to endemic levels to where it was before. So if you look at that, that's a 1.5-year time frame. So what we're seeing with this is we saw a spike, and then we saw a long, slow decay. It didn't drop, it was a long, slow decay. Same thing now. So the goal is to suppress these spikes so that we don't have a longer, slow decay. We're not coming down the mountain longer. So that's the challenge that we're at right now. So where I see us right now, 4 to 6 weeks, God willing, with the controls in place, we all help each other, we do the controls that we need to do, we'll see a long, slow decay. And at some point, hopefully a medical intervention will come sooner than later to really help suppress that. That's kind of where we're at, where treatment plans are getting better. There's even some new medication protocols to protect those at risk. They're looking at Hep C medicine and things like that. So the science community is trying to catch up. Realistically, we're in this thing for this marathon, not the sprint, right? So when I look at it from this perspective, we look at it as, what is our new normal for now? My son was a senior last year, lost his prom, his graduation, everything. So I totally get it. And you know, it was one of those milestones that Mom and I were looking forward to, and I get it. I totally get that piece. But the balance that you know, and I understand, there's no easy way out of this scenario. I can tell you that you all have a really hard job. So my thinking is, we're gonna see, if we're at the peak right now of this next bubble, potentially the next concern of surge would be when schools reopen, and then also when snowbirds come back.
So a third surge.
Well, when populations gather, you're gonna have more spread, right? So the challenge that you have is schools reopening as well as snowbirds coming back, so the October, November timeframe, right? What also complicates that is that ramps us into flu season and all the other stuff that happens. Right now, we're in rhinovirus season, so it's the summer cold. So there's always something. But my point being is that it all comes together. So what we do for COVID will also help suppress the flu, which is also helping suppress hepatitis A. So all of these control measures really help us through many different things, not just COVID, right? So in some ways, this in many ways is our new normal for infection control in a school setting. Much like what we went through with school security back when things started to happen after Columbine. My team, when we do shelter operations, as well as with our staffing now, we've gone to almost an A-B schedule where we do teleworking and we stagger shifts. The reason why we do that is because if it burns through, it can potentially take out the entire department, right? So we had to stagger folks. And so those are some lessons learned. Another lesson learned was from long-term care facilities. What we saw in long-term care facilities is we know paraprofessionals like speech pathologists go from school to school to school. Well, they act as a vector. If they're sick, they're gonna go from school to school to school. So how do you manage that component of it from an infection control, right? So we've limited movement of nurses going from wing to wing in nursing homes. Patient movement and congregating of patients in nursing homes, congregate feeding, gathering and social, those are all challenges, right? So, and then also surveillance, what we talked about earlier, more frequent testing of our community to understand our staff and our kids, where they're at as far as, so the reason why I'm sharing the nursing home because there's a lot of parallels with school districts on how they're gonna operate. Child movement, sharing of space, paraprofessionals, introduction of, one of the challenges that we saw in nursing homes was the home health workers and the medical workers, medical device folks were coming in, they were positive and introducing it into the nursing homes. Because you know the people in nursing homes aren't going anywhere. And so that was one of the areas that we, so guest surveillance, visitor strategies and things like that is another thing to consider. So this is why I mentioned the other school districts have pushed it back. So they have time to work through some of these things in order to have a better strategy. And the other is getting their arms around how many people truly are insistent upon showing up. And if that student density is 30% of what it used to be, well then now you have your space solved because you can space people out a little bit more, you can come up with your curriculum strategies and all those other things.
But I don't think, I apologize, do you think you're getting true numbers? Because I would be willing to guess that a quarter of your parents don't even know to vote on this. I would presume maybe a third don't even have computer access to know that this vote is even going on. So you're probably getting 2/3 of your students' parents who participated in this voting. So when you think you're only gonna have 30% of your kids come back, there's gonna be a third of them that have no clue that this vote even took place, and so your numbers are gonna be way off when they come back.
Well, they could, but when you're talking about voting, are you talking about the voting on the plan to come back?
Yeah,
okay, what I would recommend you do is that we need to meet that state deadline for the school plan. You have a board meeting next Tuesday. Let this percolate out into the community. Let us do our work through the schools and make a decision next Tuesday. Okay, that still gives us plenty of time. That's what I would recommend you do, because there are gonna be parents who are gonna be very upset because, you know, here's what we could do. Stay as normal for August 17th, and I'm gonna get to the rest of you who have filled out these just a bit. Stay as normal with August 17th. August 17th comes, and we just say everybody's virtual. School starts, but we're gonna do it distantly. That's probably not the greatest plan. Or we hold off opening for another week or two, or move it to the 31st. My superintendent's association, I spoke to the manager of that, who said go to the 31st. I have no direction from the state on any kind of days that will be forgiven for this, okay? There are minutes that I can pull out of the day. We briefly discussed looking at professional days for making up some of those days for the students throughout the year. The other issue we need to figure out, and I want to bring this bad boy up, is do we interrupt teacher pay cycles? Okay, do we need to figure out a way, and I'm sure we'll get together real soon. What do we do for the teachers who are coming off summer needing to get a paycheck? I used to be there, I know that. And I've got to speak to our teachers, this is not totally off subject, but all of the joy that we had when we went into the classroom, all of the celebrations, all of the friendships, not being able to celebrate graduation, not do it. It has not been fun for teachers since March 13th.
Yeah.
And if that's impacting me this way, think of what it's doing for the children.
Yeah.
Because I guarantee I have not met one teacher who said, you know what, this is fun. Because it's not fun. It's not fun at all. So we have to figure this stuff out. And I will give you my 2 cents worth, and then y'all can percolate and go on about it. But we have a whole lot of work, including making sure that we can pay teachers this time. The state has said, send me your list of questions. That was last week. I have not heard from the state yet, and that's just how things are. They're saying it's a local decision based on your community and medical opinions. So that's why I'm very valuing what you're saying to me tonight, because I now have that in my back pocket. Alberto Carvalho in Miami-Dade has medical schools and a whole bunch of other people who can advise him, and I'm sitting in Hendry, you know, calling
We got better than Alberto Carvalho, we got Dr. Lewis.
There you go.
Well, we do, but she's better than Teledoc, which is all I had. You know, so that's what I'm waiting on. But at this time, Allison Bowers, do you have something you want to say?
Well, good.
Okay.
I came in wanting I want my son to go to school. But listening to everybody, it's hard to, yeah, I don't want him to get sick. I want him to go to school, but I work at the hospital. I know the numbers, they're there. And it is, you know.
They're real.
They're real, so it's not
Yeah.
just, oh, I want my kid to go to school and that's all. I didn't think about the big picture.
Yeah.
But as a parent, all I can do is, if we do go virtual, and I know it was put on the teachers, oh, okay, we're in school one day and we're not the next.
And the state gave us 3 mandates when we were allowed to decide how to reopen. There must be a 5-day brick and mortar option for those people who want to do it. There has to be a virtual option. There can be a hybrid of anything you want that Mrs. Stitt and I had talked about, and with other people, which would be acceptable, but we could do that. Suppose we went on an A-B schedule, half the kids A on Monday, half on Tuesday, or something like that. We can do that, provided we have maintained a 5-day brick and mortar option, which defeats the whole purpose of what we're trying to do. So, I just wanted to throw that out, that I'm not making this up as I go. And when you call for direction, it's like, well, it's a local decision. Well, we're gonna make a local decision one way or another right here, but, Taylor Massey, do you have something you'd like to speak to us on?
Sure. I'm Taylor, I teach at Eastside. I've been in Hendry County teaching for 8 years. So I just want to implore the board that I feel like when discussions have taken place, it's been very much a one-size-fits-all. And elementary looks very different from a high school or middle school setting. At elementary, we have bigger classrooms, we can keep cohorts, we have bigger areas to space out in, we can do lunch in the classroom. There's a lot of other things that won't guarantee our social distancing versus the upper level. And so that's just my concern that I've talked to Ms. Stitt, I've talked to my principal. I just feel like a lot of people are a lot of times we're not thinking individualized and what's best for the student, and what each student needs is very different. So upper level, you know, they can stay at home alone. They have a little more responsibility. They understand what it means to log on. Our little babies in kindergarten, they don't have that. And so I just want to implore the board to keep that in mind as you're making this decision.
Well, and give me some idea right now, would you prefer us holding off so that we can get things better in control and going? State saying parents still have that choice, okay? Or barrel through and start August 17th as we currently have.
So, I mean, this is just my personal opinion, does not reflect on Eastside or Miss Sanchez or anything
Yeah,
like
I know
that.
that.
Just me. I know that we've been working really hard. Kristen and I run summer school at Eastside, so we've been there. And so we've been working really hard putting things in place to open on the 17th. I do feel very comfortable and ready for that at a school site level. I don't know what that looks like across the district. I don't know what other schools look like. But for our school alone, I do feel very comfortable about opening on the 17th.
Have you had any COVID cases at, in summer school at Eastside?
Yes.
We haven't been in that conversation or that discussion. That's from the health department. That doesn't come to us.
Eastside did have some positives. As a matter of fact, but it was in the special needs. And when it came up, I shut the unit down. Because we're only this week and that was
This is
it.
the last
So I
week,
shut
that's
that down.
Okay, then.
The same with CHS, I shut that down too.
Brings
when
me
we
to
did
a
that.
whole other level of, okay, so we have teachers in this school running the summer school program. Now we have positive cases that I'm assuming that they have just heard about right here. How does that notification go out? Like, how does that information flow? Who's contacting schools? What are the teachers' rights to know, hey, you were interacting with a kid who flagged positive or is presumed positive? How about notification of the children in that cohort of, to their families? Like, how does that information flow?
That's a great question. So this isn't the only school district struggling with that protocol. So you run the fine balance of duty to warn versus HIPAA violation, right? So especially when you get into smaller cohorts where it's easily identifiable who that person could be potentially. So that's the challenge there. What typically happens is a child or staff member could be tested anywhere, could be anywhere in the state, and we're notified because we're electronically notified it's a reportable disease. Once that happens, we make contact with that individual and their medical provider, some in their medical records, and go through our investigation process. So our epidemiologists, along with our contact tracers, will do our investigation and gain an understanding of when the person was symptomatic, how it was spread, all those things, and a timeline where they at work, where they, that kind of thing. Then from there, the conversation is had of notification with those contacts, as well as with the school district, mainly the administration. And then we come up with, we've already drafted a notification letter that would go out should we need to do that from a district perspective, just like we would do with chickenpox or measles or anything else. And then the other piece is then, so we have the parent notification side of things, as well as those who may have been impacted. So there's recommendation guidelines based on isolation and monitoring or getting tested and all of those other things. So that all comes into play as well. And then really the next level of conversation comes into play is how you all feel as a protocol within the school district. My recommendation is sharing that information perhaps on a grade level or at a school level, that type of thing, so that anyone that is in that environment would have the understanding of, hey, we've had a case in this school, it might be a third grader or whatever that might be. So this way, those folks are a little bit more aware of the risk. Just like in nursing homes, we have requirements that they put signage up so that if there's a COVID unit on that floor, people don't just walk into there not knowing that there's COVID patients in this area. So same general idea. So the recommendation that I've had with many different districts right now is coming up with a communication protocol. One school district was looking at, do we put up a web page or a dashboard just like the Florida Department of Health has? That can be problematic in timing and challenging on how you do that. Do we do parent call-outs, automatic call-outs and notifications? Do we do a mass email? Do we do a press release? All of those different things. So a short answer is the folks that need to know in order to take protective measures, we work very closely with them and their medical providers to do those protective measures. The public relations and the PIO component really is in the district and how you feel comfortable
Can I
with
speak
that.
to this? Because we have been working, I know more about this than I really ever thought I would need to know, but we've been working very closely with Casey McCullers, who is our school health department nurse liaison. So the protocol that we're following right now, the principals received all of the notification letters yesterday that they need to do that, whether it's a cohort, school-wide, or whatever. So the protocol is child comes sick, or a staff member is presenting with the fever. The contact person is the school nurse. If someone out in the community has contracted this, then the health department notifies the school nurse because of HIPAA requirements and things of that nature. So the nurse is the first line of defense, who then can access the bus, the seating chart, because we're finding out also that we need to take attendance on the bus every day now. So that's a new requirement, so because if a child is a bus transport, we provide the health department with that number so that the contact tracing can begin from that point, and the student schedule. If it's an elementary student, we know exactly the class. If it's a secondary student who changes classes, they're going to have to contact each class that child was in, that student was in. We're not worried about according to Casey, about the transit time between classes because it's not enough time to get there. So our people are required to give the health department all of that information. That's another thing we learned this summer with our case at Eastside. The administrator didn't want to share that information, and we said, thou must share this information, just as if it's a tuberculosis case or anything of that nature. So we go into that mode, and the cohort class perhaps could get shut down and everybody go home, and in that case, you would then go distance. If it's the teacher, same thing happens. Okay, the class has to go home. We will deal with secondary when it happens, but the fear is this is when we get everybody back, when we put 7,000 people back, how long is it going to be before we have to close? And I don't think it's going to be that long based on what we're knowing now.
So, I do have a question. So in your professional opinions, looking at our plan to reopen school, if nothing changes in 4 weeks, if we go push it back to the end of August and everything is still the same, and we say we need to go ahead and open brick and mortar, what would your recommendations be looking at this plan that we may need to add or change?
Sorry, let me take a quick peek. I think I wrote a few things down. To have a good understanding of what your safe social distancing to the extent possible, what does that mean? What's your minimum? What's the minimum that you're really going to say is acceptable? And, is that safe? Also, and I saw that you were replacing air filters more frequently, but I don't know about your ventilation system and whether or not there's the opportunity for fresh air. I know that, we're in Florida, it's hot, but fresh air is gonna be best. The face coverings, currently my understanding is that they would be encouraged. I would mandate them. And I would actually also share information with people about what are gonna be the most efficacious face coverings. So even though we use these, multi-layers with like a layer of chiffon and at least 2 layers of 180 heavy quilters cotton. I mean, at home, people have some things that they could probably use to just cut out with the free patterns to make them. I think that's going to be more protective for your student population, so I probably urge those kinds of things. Lunch, I think the lunchroom is the kill zone, for lack of a better way to say it. I mean, I don't know a safe way to do lunch if not every kid is sitting outside, but to be sitting in a lunchroom for the period of time that they are with these face coverings off, I'm just not comfortable with that. And then in terms of discouraging the large gatherings, extracurricular activities, I heard, that there's supposed to be football. That's going to be wiped out quickly. I mean, just look at the major professional baseball teams, let alone now you got to go to an away game or they're in practice together and they're really close. So I think you have to look at large gatherings to try to increase the amount of safety as much as you can with the type of required face coverings and no lunch or lunch outside very far apart, which, I mean, I don't know the capability of doing that. Those
But then
are my thoughts.
what do you do on a day when it's storming and raining? You know, because we get a lot of those.
Use the gymnasium.
And that also
A lot of class
contradicts,
going on.
safety protocol.
Yeah.
Say what?
And that also contradicts safety protocol
Yeah.
for our, our.
And that's why I wanna know what your
Yeah,
opinions are, you know,
from the
what,
medical perspective, those are the things that I would have to figure out how to accommodate, or I don't feel it's safe.
Our plan right now for lunches is, we have some elementary schools who can accommodate distance eating.
in
The social
classrooms
distance
or?
during lunch. We have East Side, West Side, who's no way they can do that. So they're going to be in a cohort in the classroom, and we had discovered that we were able to cover the classes with paras, particularly since the CARES Act has allowed us to hire more paras so that everybody would have their lunch period. In the high schools, they can go to 3 lunches plus the outside and have the social distancing. Some of our elementary schools are gonna go half and half. Half of the students are gonna be in the classroom, half are gonna be in the cafeteria. Perhaps like the younger students, pre-K through 2, would eat in the cafeteria, they can handle that social distancing. Lunch is going to be, and we worked through all of these details, I'm glad you're answering those, we worked through all these details yesterday and today, is basically gonna be one choice. So we're going back to, instead of the offer versus serve, the 5 things are gonna be in the bag, go into the
Get 'em in, get 'em out.
student. At the high school, they're gonna have 4 choices, and the 4 choices will be in every line prepackaged, so that they walk through and go and get and eat. It's not perfect, but it's better than the congregate eating that we were having. And the outside is perfect. We have both high schools have outside dining areas, and the middle schools have, the one middle school has some, and the other, they can add more to that. So we can go ahead and handle that, but we have, I'm very thankful that y'all are here to give me, because you're like reinforcing what I thought I was thinking anyway. And it would be, is there anyone else who wants to speak on this?
I have just a question. That was brought to me, so it's not my question, but I figured I'd ask, and it's a very extreme, but for legal circumstances, they were just curious that, like, say a parent chooses to send their child to school and the child gets corona, and in the worst case, they end up passing. Can they hold the school or the county liable in any way?
Does that fall under sovereign immunity?
We would fall under sovereign immunity, and our attorney is up there, but we don't fall under liability for flu cases.
Right.
So it would be sort of like the same type of thing. If we can show that we have taken all of these precautions, our liability is marginalized.
Right.
If we have been negligent, our liability shoots up.
Okay.
Okay?
She's nodding in agreement.
Well, then I earned my A today. That's
good.
So some of the things, when you talked about practices as well, one of the things we had to do with the health department is we took a hard look at what is our capacity when we space effectively? And that dramatically reduced that. We're going through that same exercise for sheltering because of the new guidance for social distancing. That massively diminishes our ability to shelter the density of people in a building. So those are problematic. And so I would imagine the same things for schools, is the capacity of a school would be diminished dramatically, and then getting an understanding of who's coming and not. But a lot of districts have, and we've had to do this as well, is rethink our larger spaces, like our cafeteria / training room, our board rooms, all of our meeting rooms, have all been converted to makeshift cubicles and call centers and things like that, so that we can support distancing. And then also the different shields and precautions that we have there. And then lots of screening. So we test regularly, we monitor in and out, we do self-monitoring, we also do temperature checks, you know, in and out, we do O2 sat checks, we do all kinds of things for surveillance purposes to minimize that spread, right?
Well, and that's why I was asking about what your recommendation would be. Would you recommend we temperature check every student as they come in before they get on the bus?
It's in the plan.
We're doing that now.
That's gonna happen when they come to school.
So we're gonna funnel them in through one gate?
Well, we're gonna have temperature checks at the bus ramp, at parent pickup, at the high schools, at student parking lot. So there are gonna be 3 entry points, and we're going to do that. The student presents with 100.4, they report to the nurse. If a faculty member, and we're doing students and staff, faculty member comes with 100.4, they report to the nurse. We are requiring some sort of clinical care in that event. And to our definition, the nurse is the first point in that clinical care. Because it could be that you have a sinus problem, it could be whatever, and the fever subsides. We're saying if it subsides with, I think now the guideline has changed for 24 hours without help of an analgesic or something of that, is that the right term?
That is.
All right, I got another. Without the term, without the use of an analgesic, they may come back. If they come back and present, again, they sent home, again, student or staff member, the CARES Act provides up to 10 days for a person to access without a charge against their sick time. So we're saying if we're telling you to stay home, we're not charging your sick days. Because that's us, that's not your choice, that's us saying that.
Right.
So up to 10 days, and hopefully they can recover, because after that 10 days, then we start impacting their sick time, but there is no limit. Suppose somebody, a mom is a teacher and she gets it, or she has to go home and she has to stay the 10 days and then her child gets it. There's no limit to how many times you can access the CARES Act days.
Okay.
But
That's good.
we do say you need to start getting clinical care to access those, or a doctor. Because the other thing, I don't even want to say this, most teachers and people are going to do what they're supposed to do.
Right.
There may be somebody who says, well, you know, I'm not going to show up for a couple of weeks, and I'm going to claim COVID. Well, they can't do that unless they have the medical.
Are we gonna mandate if they do come in, we have to send them home for those 10 days? Are we gonna mandate that they go get tested for
Depends
COVID?
on, their direction is going to come from the nurse.
I mean,
So
are we
if
going-
that person does not, if the fever continues, they're gonna have to get tested. When if the test comes back and we can get them quicker, positive, then we mandate you're home for 10 days. So up to maybe 14 days during the presentation of this disease to its conclusion, they'll have 14 days under the CARES Act. Now, they have 10 days, but I'm adding a few because of the presentation of a fever that requires them to go home.
Okay, I misunderstood the beginning of that. I thought when you said that they come in with a fever, you didn't say that anything about COVID or had to have a COVID test. That's why I was that's
No,
why I
if
was
they come in
asking.
with a fever, they go home.
Okay.
That was one of Dr. Pepe's first things. I'm gonna check, I'm gonna be all about sanitation. I think I'm almost directly quoting you. All about sanitation and how quickly you can identify and isolate a student who's ill.
Right.
So those are our 3, or a person who's ill, those are our 3 things. The fever itself will cause somebody to go home.
And then
So
they
that's
have to
why we're
test.
saying, if you don't feel good, stay home.
And the CDC guidance has changed dramatically. It used to be testing back in and double negatives and all that stuff, but because of the things I mentioned earlier, that's problematic. But what we're seeing now is so long as it's 24 hours without fever, without medication, then we feel that the person may still have symptoms because there's a long recovery for some folks.
Yeah.
We've all had the flu and you feel messed up for weeks,
Right.
but you're not infectious.
Right.
So that's kind of that balancing act is, how do you bring folks back quickly as possible because it has an economic and other impacts, but not reintroducing it back into the organization. So that's, and we would work very closely with you on that conversation. Well, the other thing I'd like to say is that we're in this with you, you know, so if you need me to come back 10 more times, I'll be here. If you need my team here, we'll be here. If you need us to test in the schools, we'll figure it out. Whatever it takes that we need to work together to make this work, we'll figure it out. Okay, so, you know, I mean, I think we're all in trouble together trying to sort this out, so we'll figure it out together, right? And if it works, great, and if it doesn't, we'll adjust. I think that's really the answer, because I think all of you and everyone here all has the same spirit and intent. We want to get back to normal as fast as possible and as safely as possible, and however long that takes, we'll see. But whatever we need to do to adapt in the meantime, and as this changes, I mean, right now I'm getting texts, I got a hospital on diversion, and we're looking at a tropical development right now, which.
That's all we need.
So now we're working on shelter operations in the same. So what I'm getting at is, the only thing that's consistent is change. And so when I've been asked the question, what happens if we get a hurricane, then my answer is, we'll figure it out and deal with it and move on.
There you go. And
so the same thing is gonna happen here. What happens if you get a case introduced into your school? We'll figure it out, we'll do the best things we can do, make sure that they're okay, and we'll move on. And that's really what we're gonna do together. So I just wanted to share that, and thank you for having me here, and I know Doc is great. We work closely together, and you know, it's, whatever you need, we'll figure it out. Okay, so just thank you.
I do have a question. I'm sitting here and it popped in my head. You know, I made the comments about our rates being less favorable than surrounding counties and counties that have mandated masks and have taken other precautions. Why is Hendry County not there if our data supports that?
So the statistics, let me, I have to kind of walk you through, and I'll be brief, I promise. When the outbreak first happened, it hit our nursing homes very hard. So we had a significant amount of people impacted that are above the age of 80. So that significantly impacted mortality rates as well as the spread. As you can imagine, once it gets into a closed environment like that, it burns through very quickly. We didn't have an understanding of the spread and best practices, and so we've since fixed that. The other side too is there's a statistical problem with percentages. So we have a small population. If we had 3.5 million people, it'd be a very different percentage. The rate of change in percentage is very slow. It's very easy for us to have a 5% jump in statistics because our population is so small. So that's the other component too. So when you look at mortality as a function of total cases, and our numbers are much smaller, so those percentages will change dramatically. You can get 5 cases and significantly change that skewing of the percentage. What I'm seeing is when we started to see sustained transmission in households, for whatever reason, either it was a disbelief, a shock, lack of trust in what's being told, whatever it might be, for whatever reason, people weren't wearing masks, they weren't doing protective measures. We were literally contact tracing. We'd call one person and then call the next person, and literally the phone would ring and the person's sitting in the living room with the other person and they're in the same house. So they're like, oh yeah, he was sitting right next to me, blah, blah, blah. So my point is that we have homes that are multi-generational homes with high-density living quarters. So it's very easy to get 8 cases very quickly. So that also impacts us. Whereas you may see, let me talk about Charlotte for a second. It's the second oldest population, right? Most people that live in homes in Charlotte County, 50% of the population is retired. There's no kids in the house, they're husband and wife by themselves, or a single person living in a house. So it's really hard for them to get something if they limit their transmission. When you have 8 people living in a home, that's a very different model. So that, I hope, kind of explains the differences. And then I think there was some degree of, we're a younger population, and so we were constantly hearing that this is an older person's concern, and so therefore, maybe it wasn't taken as seriously in the beginning as it is now. So those are all kind of factors together. We've done lots of education. We've actually are in conversations right now with an ad agency to put together another campaign just to kind of to get the information out there and across all language barriers and cultures, and we've reached out to our faith-based community and some other folks. So, you know,
that will be for Hendry?
Yes, sir.
Good, thank you.
Yes, sir. Yeah, we're working with an ad agency out of Fort Myers. We have some CARES Act funding that we're allocating towards that, so really hoping, not only social media side of things, but also non-traditional type things like table tents at restaurants and gas pump signage and things like that, just as a continuous reminder of best practices and things like that, so I hope I
It's
answered.
just
your
shocking to me that we have the data that we have and not the response that we've had from neighboring counties. When I look at our reopening plan, and I know that, I know that you were involved in that, and I made sure to send a copy to Dr. Lewis. What it lacks, I'm a reader, I barely sleep, so I'm up all night reading and looking at what other states, other districts, other people are doing, and looking at their reopening plans. When I look at the reopening plan as it is, and I'm not trying to be critical of anybody who worked on it, but we've had limited information and we're waiting for guidance from the state that's not coming, and it's vague to me. And I shared a plan that I thought was really good this weekend with the superintendent. It was like 17 pages, but it was very, when you read it, anybody on the street could read it. It talked about how they're classifying the communities, where their community is. These are the procedures and protocols that we're going to do for this, and it was reassuring. I don't feel reassured when I look at this plan, and I know we just have such an incredible heavy lift, and just hearing the testimony here of this not being influenza, this not being things that we've seen before. And I think when we've got 7,400 of the best kids in the world, when we're responsible for them, 1,000 staff members, we have a responsibility to do it well. And like one of the things I always say is we can't guarantee safety in a school district. It's in the same premise that the things we do for school safety and to prevent, people getting on campus, dangerous people, we can take all the precautions in the world and prepare, but you still can't guarantee it. And so what we're really, I guess the goal is to mitigate it and to not have it just, like what you said, in the nursing home, and that population just spread through like wildfire and take out the second largest employer and 7,400 kids and their families. And I just, I've heard what the superintendent has said about suggesting pushing it back. I just don't feel like what we've had now and the information we've had to work with, especially when we're comparing to the plans that our neighboring counties are doing, and I'm not real confident in what we've got going now, and hopefully we can get that clarified and actually get written protocols and procedures into place. Because, I'm just speaking from intuition here and seeing that interaction of, you have to have, with the teachers from summer school, you have to have a plan in place, it has to be written, and it has to be enforced.
It's there. Now, as far as our opening plan is concerned, we modeled other districts who had already submitted and gotten approved, because there were only 4 of us working on it. Because we're thin.
Yeah.
So we feel it meets the muster. Can it be amended? Yes, it can be amended. So that's why I would ask that the board approve this plan, and that you allow us, because we might be changing it, speaks to starting on August 17th, and we may be changing that.
And we can do that.
You can do that, but the next meeting is after the deadline for submission of the plan. So in all its flaws, I would recommend that we go ahead and approve this reopening plan. I think in bits and pieces, I'm not sure the great public is gonna read a 70-page plan. But we have signage going up in the schools of what's required. We are sending things home from the schools to the parents of what's required. The decision tree that we borrowed from Charlotte County is in place and is gonna be there. The protocols are there, and we're gonna have to double ensure that they're followed. Because like I said, one of the learning curves we had this summer is that they weren't followed, and they were there. So fortunately, it happened, and we were able to go in and correct that. So we can do more, but we need to meet a deadline. And I was just grateful that I was able to get you the plan before tonight, frankly. So that would be my recommendation. You also see that there's a request to amend the calendar. I would like to hold off on that because I don't think you need to amend it twice. So hold off on that, and those are my recommendations for the next two items.
All right, so you're gonna, just so we're clarifying, you want to recommend the approval as it, or the reopening plan as it is in here, with the intention of amending it?
We're gonna have to amend it, depending on the change of the date. That's the minimum amendment that we're gonna make. Okay, we have other things that we can add as addendums to it, which are the safety precautions that you're talking about, you know, that are already there and at the school, so we can add that to it and then make other amendments to it. But the issue is we've got to get it approved first,
Okay.
then we can change it later.
Then it would be like a working document, per se, right? Okay.
And you would have that option to push back your start date,
Even if we approve it?
even if we approve the August 17th.
Yes, I would have that option to make
Okay.
that amendment.
Yes.
We have not been told by the state, because one reason we decided to just glom onto what other districts have done is because there was no guidance coming. So we're sitting here thinking, how are we gonna reopen? So we looked at one of the first districts to get approved was near Orlando. It wasn't Orange County, but it was near Orlando where Kissimmee is, Osceola. So we borrowed heavily from what Osceola had done. We also borrowed heavily from Pasco.
Mr. Paletti, what if we decided, because if I understood it right, the governor's mandate was we will open in August. What if we go into September? What are the
Well,
repercussions?
I think the mandate is that we need to start sometime in August. That's why we're looking at the 31st, which would be a Monday.
But if we decided to wait till after Labor Day, are we gonna get spanked, and how bad? How big of a paddle we're
Well,
gonna use?
you don't want to monkey with the funding.
Yeah.
And if I can forgive as many days as we can, or not forgive, but if I can accommodate as many days as we can. For instance, and I'm just pulling numbers out of my head.
Yes.
The state says you must have 5.5 hours of instruction. Well, our students have a 7.5 hour day, so we have 2 hours to play with per day.
Right.
So I can look at that and start taking those days away. We can look at professional days and add those back in so that our calendar still looks the same
Okay.
with the days and the requirements for the students. But, you know, I think we need to hear, is the community willing to wait another 2 weeks?
Oh, I agree. I'd love for them to do a boardroom next Tuesday.
Okay. And we need to know if this is a non-starter also.
I'd love for them to fill the
Because
boardroom.
I think we've got the health data to back what I'm saying.
And there's a pending lawsuit asking for an expedited hearing. The lawsuit filed by FEA against the state for failing to
Yeah,
open this.
but and that's at work.
And that
I mean,
has to be expedited.
For instance, the state said very publicly, if we could open a Walmart, we could open schools. Well, the difference is people are not spending 5 days a week, 7.5 hours a day in Walmart.
Yeah.
Right.
But they are in school.
Yeah. Sure. Absolutely.
Okay.
Do we have a motion already?
So
No.
we have talked this, we've got the motion down. This is for action item C, reopening plan for school. We got the recommendation of motion. Do I have a second?
Second.
Any further discussion? Well, one more, I'm just kidding. All right, all in favor?
Aye.
Any opposed? The reopening plans, as they stand, passed unanimously. Revised school calendar, you want to remove that?
Remove that
Okay.
until I come up.
New personnel allocation request, do I have a recommendation?
I recommend approval, and that represents additional people that we're hiring for the CARES Act to accommodate additional cleaning, additional supervision, and things of that nature.
Yes, sir. Okay. Yes, thank you guys.
I just
very
don't know
much.
if I could leave. We were.
Yeah, you can, I just want to say
Yes,
thank you for
y'all very much.
participating in this.
Thank you. Yes,
Thank you.
Thank you for your time and your expertise.
Appreciate it. Thank you for having us.
Yep.
Okay, we have the recommendation, do I have a motion?
So moved.
Second.
All right, any discussion? All in favor?
Aye.
Any opposed? Action item E passes unanimously. Under board member business, emergency policy 1700, mandatory face coverings during a COVID-19 emergency. Superintendent, do I have a
I
recommendation?
recommend approval of that policy, and I want to remind the board members, this is for a limited time.
It's a 90-day policy, it's an emergency policy, so it's only in effect for 90 days.
But you have to set the date. Should you wait until we know when
We
school's
have,
gonna
well,
open? You set the date when it
Because you
says
have
that
the
you have to
90
set the
days.
date.
Yeah. So we need to table this till our next meeting?
I would rather,
Start it now.
I would rather we get that in place, because there are a lot of teachers concerned about this. Do I have to set the date at this point? I'm looking at Molly. Yes?
Yeah.
No, Mike?
She said wait.
I guess.
No?
I'll tell you what we're gonna do. And this isn't, let's make a deal. Teachers report August 3rd. We need to make it effective August 3rd. 90 days
Can you hear
out
me?
from there.
There you
Oh,
go.
there she is.
Okay.
Oh, I'm so sorry to interrupt you, superintendent, members of the board. The policy, if you approve it tonight, would be in effect starting tonight. It would go for 90 days, but what you can do is you can adopt a more permanent policy. So the reason for the 90-day time limit is because you're doing it on an emergency basis without your normal public hearing and notice. But now that gives you the opportunity, you've got 90 days in which you can adopt a more formal, long-lasting policy.
Okay.
And then when you don't need that policy anymore, you can just, repeal it. So that is really why the 90 days is there, is because it's being adopted on an emergency basis without the formality of a normal policy. But that just gives you the time that if you need this to be in effect longer, then you can go through the normal policy process to adopt it as a normal policy. And then I would recommend that you would repeal that policy, like you did earlier tonight with another policy when it's no longer applicable.
Okay. So it would be, if you approve it, it's effective tonight, 90 days out.
And that is anyone on campus in a school must wear a face covering.
Other than, there's exceptions,
No, to
children's
the
under
ESC,
2, medical
yeah.
certification, students
Yeah.
with supervisors' approval, employees with supervisors' approval, outdoor with social distancing, regular scheduled meal times. I mean, there's a long list of exceptions. It states that we're gonna be required to provide their own face covering, so, yeah.
Who's the supervisor? Would it be the principal of the school?
Pardon?
Who would be the supervisor?
The people who are, the supervisor is the boss. Now, at the school, it would be the administration.
That's what I mean.
Yeah.
At the school, would it be only the principal? Would it be the principal, the dean,
It would be
the administrators?
administrators,
How
yes.
many people, and do we need to
Yeah.
make them, everybody aware of who can tell,
Well,
who can get on and who
you
can't?
You can tell, and then this is gonna be a real easy one to see. They either have it on or they don't. And it's like, we can figure that out. If there's a problem in a classroom, the teacher can refer that discipline issue to the office to address that problem. I will say, I did visit a pre-K class at Up the Grove this summer, and every little one was wearing a face mask without a problem.
They had them on at playground today.
Yeah.
Some of them think it's cool.
Yep.
But if they're in the classroom and they can socially distance, or they have plexiglass or whatever, they don't have to wear the mask at that time, or do they still?
Plexiglass, that's not gonna.
Well, I know, but this was a question that was asked of me, if there's a
Have to wear it all the
plexiglass.
time.
I just have concerns about wearing a mask all day, every day, especially with the younger kids.
But then if that is a serious issue for a parent or a student,
They have the
they
other
have option
options.
2.
This is
Yeah.
true.
So that's, or 3, or
Correct.
whatever else they want to do.
Okay.
All right, we have the recommendation. Do I have a motion? Second. Any further discussion? All in favor?
Aye.
Any opposed? Board member business item A passes unanimously. Board member business item B, 2020-21 Florida School Labor Relations Services membership dues. Superintendent, do I have a recommendation?
I recommend we pay our dues.
Okay, do I have a motion?
So moved.
A second.
Second.
Any discussion? All in favor?
Aye.
Any opposed? Board member item B passes unanimously. Board member business item C, permission to advertise proposed policy revisions. Superintendent.
I recommend the board allow us to advertise the proposed revisions.
Do I have a motion?
So moved.
A second?
Second.
Any discussion? All in favor?
Aye.
Any opposed? Permission to advertise passes unanimously. Financial statement is FYI. Do we have any further board member comments? Mr. Basquin?
Madam Chair, I just would like to put out there that once again, in some of our communities, I know in Clewiston, they're doing backpack giveaways. Just amazing, the outpouring in the community still even today. You know, so I just want to thank all of those people that are participating in those things. Just incredible. And so the people that are, if there's anybody watching that does not know about it, contact the radio station in Clewiston. They can give you more information on that. I believe it's this coming Saturday though. So that's it.
Fantastic. Dr. Berg?
That's it.
Vice Chair Nelson?
I'm done.
Okay, and I just wanted to, I don't know if everybody noticed these fun and fabulous face masks that we have on, but these were made by a Hendry County student. And her name is Tegan Barnes. Tegan Barnes, you can look her up if you guys want some. But I just thought this was a fun way to celebrate, our talented students and what they're doing. So that's it for me. And Superintendent, do you have anything further?
Of course.
All right.
Okay. The last meeting I attended, the question was raised about the governor's veto of the Guardian funds, and I told you what we thought was the party line at that time. What happened is the governor vetoed all of the money, but kept the program. So the money was earmarked for training. Hendry County had $22,000, which is part of why the confusion was in there, because the money was in the pipeline. Hendry County had X number of dollars for additional training, but because there was not enough time to have another cohort group of guardians, Hendry County had to give back the $22,000. So it led you to believe something that really isn't there, but right now, that's the honest bottom line truth of what happened. We did not realize it, we did not think it, until we got down to the nuts and bolts, and then our association and others said, no, the money's gone, it's gone. So the program is still on the books, there's no way to fund it and no way to train additional guardians if we have people who wanted to be trained.
So where does that leave effectively leave the program?
Well, we still have guardians. As a matter of fact, some of our guardians were recertifying today and yesterday, and some of them were not here because of that requirement. So we still have them, we just don't have a new crop.
New batch, all right.
And one of the problems is it is compressed, the training is compressed like during the summer, and we have very few people who say, I'll do it. Now, they'll do it if the training could happen throughout the year.
Yeah.
But, that's a big commitment out of a chunk of summer, and people aren't willing to do it. But we do have guardians. We're just not gonna have any more for a while until it's refunded. Secondly, I just wanna put you on notice, I'm probably, depending on conversations with a whole bunch of other people, gonna recommend next Tuesday, August 31st, as an opening, okay? I reserve the right to change my mind like everybody else does when we're dealing with this. It might be the 24th, but it looks like it's gonna be the 31st, based on conversations I have to have with a lot of people. I'm just telling you that so that it's not a surprise, so that you can also tell your constituents that.
You see the look on my face right now?
Okay.
Well,
That's all.
I appreciate the communication over the last few days, and as you work through your process and figure out what you want to do, just please communicate it to us on the board so we're able to, be conduits and help you communicate that in the community, and also we don't
Sure
get
will.
blindsided.
Thank
But,
you.
so thank you all for attending tonight, and, this is kind of a roundtable style, but, thank you all for your input, and meeting is adjourned.